And there'll be some times where the presenters are going faster than my head is spinning, so I may need to go back and look at some more.
Okay.
Thank you. Does it look like our guests are in the waiting room or wherever they go?
It does. Should I bring them in?
Please.
The 18th.
Good morning, everyone.
Good morning.
So, Representative Weiler, sir, are you ready?
I'm ready.
So being 9:30, I'll read the checklist for the right to know meeting requirements. As chair of Division 3 of the House Finance Committee, I find that due to the state of emergency declared by the governor as a result of COVID-19 pandemic, in accordance with the Governor's Emergency Order number 12, which was pursuant to Executive Order 2020-04 as extended, this public body is authorized to meet electronically. Please note there is no physical location to observe and listen contemporaneously to this meeting, which was authorized pursuant to the Governor's Emergency Order. However, in accordance with the emergency order, I am confirming several things. We are A, providing public access to the meeting by telephone with additional access possibilities by video or other electronic means. We are utilizing the Zoom video webinar for this remote meeting. All members of the committee and the staff of state agencies with agenda items have the ability to communicate contemporaneously. Somebody's not on mute. I just thought I'd give you a heads up. During this meeting through this platform, and the public has access to contemporaneously watch and or listen to the meeting on Zoom or phone. Directions and links provided in the House calendar. And there's a link there to House calendar number 8. It's on the Gen Court page. B, providing public notice of the necessary information for accessing this meeting. We previously gave notice to the public of the necessary information for accessing the meeting telephonically. Instructions have been provided in the House calendar. C.
Calendar is number 8.
Hey, Representative Bean, if you put yourself on mute until you're ready to speak, please. Thank you. C, providing a mechanism for the public to alert the public body during the meeting if there are problems with access. If anybody has a problem, please email LBA_fiscal, FISCAL leg.state.nh.us. D, adjourning the meeting of the public is unable to access the meeting. In the event the public's unable to access the meeting will be adjourned and rescheduled. Please note that if we take a vote, all those votes will be done by a roll call. So with that, Mr. Clerk, let's start the meeting by taking a roll call attendance. When each member states their presence, it would be great if each would also state whether there is anyone in the room with you during this meeting, and that's required under our right to know law.
Thank you, Mr. Chairman. Representative Irf.
Present, alone in my home office.
President Weiler, I'm alone in this room. There are others in the House in Kingston, New Hampshire with me. Representative Bean.
I'm present. I'm at my home. My wife is in and out.
Representative Wallner.
President, and I am in my home in Concord, and I'm alone.
Representative Nordgren.
Representative Nordgren here. I'm in my dining room in Hanover all by myself.
Representative Rogers.
I am in Concord in my apartment and alone except for my dog Romeo, who will be popping up now and then.
Representative Edwards.
Where art thou?
Representative Edwards.
I'm present in my office in Auburn. I have family in the house, but they're not likely to come into my office.
Mr. Chairman, all committee members of Division 3 are present.
Thank you. Thank you so much. I'm going to try to share something. That's not what I intended to share. So I was trying to, what I'm trying to share. How do I unshare? Stop share. Okay, what I was attempting to share was the people that we're expecting to hear briefings from today. Mr. Ripple, you sent me an email that I just attempted to share, and I didn't do it very well. So, oh, wait a second, here we go. I bet you this is it. Can you see the email that says
Yes.
we're going to start at
Yes.
9:30? Okay. All right, so this is the game plan for today. I want to verify with you, Mr. Ripple, that this is everyone that you think we're going to talk to today, from the overview of DHHS all the way to the information systems department down at the bottom.
That is correct. That's all I expect today. As mentioned, there may be other people in addition to the names mentioned here who are able to answer questions posed by the committee.
Okay, but the topics are defined here.
Yes.
So with that, I think we're getting ready to introduce Commissioner Chevaneh, and it's a, yes, ma'am, Representative Nordgren, do you have something?
Yeah, the email's still up there, so I couldn't see, sorry. So I'm just wanting to know if you could explain what the plan is for today. We got this sheet of paper that lists where all the pages are in our huge book. And so I'm wondering if we're supposed to be looking at the budget book while we're hearing these presentations now and for the next few days, or are we gonna have presentations and then start the work of going through the budget page by page at a later date? Clarification.
That's a very fine question. Here was my concept. I wanted to start out by making sure that we understood who the speakers and departments were for the day. That's why I shared that email. And with that confirmed, prior to each individual starting their department, my intent is to take a few moments administratively to make sure that we all have the right part of the spreadsheet up and the right part of the PowerPoint ready to share. And we'll go through as the departments have prepared for us today, at which point when they conclude, we'll ask questions at the end. And if you have a question in the middle, just raise your hand and we'll interrupt. And you have a follow-up. Go ahead.
Thank you, follow-up. So we're supposed to have our big budget book beside us also, so we can go back and forth during the presentation? Is that what you're saying? I'm confused. I'm sorry.
No, that's fine. I'm probably misspeaking. So the budget book is not yet available. I think that got clarified by Mr. Ripple in the email last night that our budget book has not been printed. It's not been mailed out. What we have received are emails with the spreadsheet, emails with the draft House Bill 2. That doesn't look like, go ahead, Mr. Ripple.
Sure. I was just going to comment that I think everyone was mailed a hard copy of the governor's recommended budget. Is that right? So you should have,
Yes.
what you don't have is the briefing book to be provided by HHS. And I think you'll get that by early next week latest. So my expectation, and the committee may have a different idea, was that following each presentation for each division, the department would then walk you through the budget pages for that division. So my thought was that you would actually be looking at the budget pages starting today.
Well, does that answer your question, Representative Nordgren?
Yes, that's not the way we've done it before, so thank you for the clarification.
Okay, and I knew that we got the big binder. I thought we were referring to the budget book, which is something different. All right. So Commissioner Chevenet, and then not representative, but Ms. Rounds is co-starring with you today.
Yes, yes, I will. If you're ready, I'll go ahead and kick us off and share my screen.
Okay, before we do that, I just want to make sure that you're welcomed to the committee. This is going to be a little bit different than the way you've done it in the past, I'm sure. I wanted to introduce myself to you to say that I have a long career in the Army and working with budgets. And when I take a look at budgets, I have very specific questions. My goal is to understand the underlying operations. In the military, we used to say no money, no mission. And the opposite is also true. If you have a mission, we need to finance it appropriately in order to get it done. So what my goal is in these meetings is to really get to understand more about your operations. I took a look at your presentation that you put together, Ms. Rounds, and it looks like you took the template that got sent to you by Mr. Ripple and that you attempted to incorporate parts of it into your presentation. Is that right?
That's correct. Yes, I believe that will answer virtually all your questions.
Okay, I really do appreciate that. That's going to help me a great deal. And so with that, if you need some help sharing your presentation, you may start.
Great, thank you. So first, just introduce myself. I'm Karen Rounds. I'm the Chief Financial Officer for the department. I've been with the department 3 years. The first presentation we're going to do today is an overview of DHHS and our overall budget. And then we're going to start going through the OCOM, Office of the Commissioner budgets. Lori Weaver will kick us off there, and then I will use my accounting unit for finance and contracts as our guinea pig, if you will, to sort of walk through how we might go through this process. And hopefully that will answer a lot of the questions that you have on how we typically go through it. So with that, I'm going to go ahead and share my screen and the presentation. Okay, and I'm going to go ahead and turn it over to Commissioner Chevenet.
Good morning, everyone, and thank you for the opportunity to sit and talk a little bit about the department and what we do. I think most of you know that we've spent the last year largely focused on COVID at DHHS. It's been a trying year for sure, but we are looking forward to being more future-oriented and forward-looking. Some of that is with the hope that we're about to see some relief from COVID so that we can go back to focusing on some of the things that we were doing prior to COVID and really start looking at the impact of COVID and trying to pull some of our vulnerable back into society and their communities in a way in which they were prior to COVID and probably in a better position post-COVID. So what you're going to see throughout the budget is really focused on transformational change of our systems. What we've discovered during COVID is definitely some gaps in our system, but a lot of the things that we're focusing on in the next biennium are things that we've been working on more on a micro level. And part of the mission is to zoom back and say, what do we really need to do with this system or this operation to make it to be transformative? And transformation doesn't just involve transforming the systems of care through operations and infrastructure, but it also involves transforming perspective. And sometimes that means redefining how we think of things, on how care should be provided, who should be providing care. So I think what you're going to see interweaved into this budget and into what our mission is for the next couple of years is really looking at our systems and how we define them, how we should be redefining them, and really about building on strategy and transformation of our systems. So if we want to go to the next slide, I'm just going to give you a general overview of our mission, and you will see that our mission is to join families and communities providing opportunities for citizens to achieve health, meeting the basic human needs and the health need, and providing treatment and support for our most vulnerable residents, and to protect and care for New Hampshire. So although this is our mission,
Sure.
the one thing that I do want to
Madam
point out,
Commissioner, hello?
Yes.
Are you willing to take questions, or do you want to go all the way through to the end before you take any questions? Like on this page, I want to ask if this is a statutory mission or if this is a mission that's been developed through years of experience.
so that is definitely something that I'm going to have to go back and look at how the mission of the department was developed. Our mission and our mission statement is much longer than this. This is just a brief snippet of what's in our mission, but I can find out its development. I know that it's been around for a long time, so we can do some digging and find out how this mission came to be.
Okay.
For sure.
I'm sorry to interrupt you, but it's just that this is going to be a consistent point that Ms. Rounds may pick up on, is that I think it's important for us to be able to distinguish between the missions that you have statutorily versus the missions that have been adopted or taken on because they're just good for the general public. So I'd like to know where those boundaries are as I learn your department more deeply.
Okay, great. We can do that. So one of the things that I want to point out in our mission is that although this is the mission of the department, it is not only our responsibility. A lot of times what you'll hear either through media or through legislative hearings is that this is the state's responsibility to take care of the vulnerable residents. And although it is part of our mission and our responsibility, many of our initiatives in the coming 2 years will involve working with our partners in the community to enhance care in the community, because it is also the community's responsibility to take care of our vulnerable residents, whether that be other healthcare systems, our hospitals, our community health providers, in communities in general. We all have a collective responsibility to take care of our most vulnerable citizens. Next slide, Karen. So some of the key roles for DHHS, you will see, number one is to educate the public, and we do this in a variety of ways through both direct care, direct client-facing services, and also through, our public health department, who does a ton of public education around all things public health. Deliver services to clients. You will see that we have many client-facing services that we are responsible for. Both our district offices around the state that does eligibility. We have a call center, and then we have some of our direct care providers, which you probably know very well: New Hampshire Hospital, Glencliff Home. We have a DRF in Laconia and the Sununu Center, all state-run direct service providers to our clients. And then protect the health and safety of our citizens. We protect the most vulnerable, ensure prevention work is done to prevent becoming vulnerable. And much of that is done in public health and through some of our, DCYF and Adult Protective Services programs. We provide regulatory oversight to all of these entities: health facilities, child care facilities, food service, and public health disease prevention and surveillance. We do this through licensing and certification in most areas, but we do have a very prominent role in regulatory oversight. And then ensure program and operational integrity. And I think what you will see this biennium as we look at transformation in partnership with our our community providers, is more of a focus on this to ensure that when we fund or we provide grants to our community partners, that the programs that are being delivered have the outcomes that we anticipated. And I think, historically, I think that we work very hard to fund and provide programming to different areas of our state. And once it's going, we're happy and we're thrilled. And it's not often that we take a step back and say, now, are the outcomes of that program what we expected to be 3 years ago or 4 years ago when we first started the program? How are they measuring up? And I think what you will see in the next 2 years is more of a focus on that we start to evaluate, how are our doorway programs doing? How are our community mental health services being provided? How are all of our contracts being provided, and are we expecting the outcomes? How is Medicaid doing? One of the biggest contracts in state government are Medicaid managed care. How is that model for New Hampshire? Are we seeing the outcomes that we anticipated? And the program and operational integrity part of the department is going to be really important in those evaluations. Next slide, Karen. Thank you. This is the overview of how the department is structured. You will see that we're broken up into 4 or 5 different areas and then some sub areas under that. This has been the organizational structure for the last couple of years in the department. It works well in our current structure. As we start looking at transformational change in the department in both our systems and our definitions, I think that you will see some change in the organizational structure of the department. Next slide. This is the general staffing of the department, and you will see that we have a grand total of 3,226 positions in the department. Of note that since the beginning of COVID and hence the hiring freeze and just the general the climate and the environment of working with COVID, we have 760 positions open, which is about 20% of our total positions. With the lifting of the hiring freeze, we do expect to be aggressively recruiting for those 760 positions, but it certainly has impacted our ability at the department over the last 6 months or so to really get out and be proactive in a lot of the things we've done. Like I've said, a lot of the work that we've done for the past year has been on COVID, and that's, although COVID sits in public health, it really has been a full department effort. We have staff from every area of the department helping out in COVID operations. So this is going to be a significant effort on our part for the next 2 years, is to take that vacancy rate down and to fill those positions so that we can be transformative. Next slide, Karen. So I just want to touch a little bit of the impact of COVID on there's the impact has been widespread, but I'm going to highlight a couple. The public health response, obviously, they are at the forefront of everything we're doing on COVID. You see Dr. Chan and Dr. Daly speaking at our press conferences each week. They are really leading these efforts in the public health forum. Some of the things that we do, the case investigations and the contact tracing being probably one of the most significant parts of our COVID response, but then education around schools and nursing homes, university systems, and the general public. We do a ton of education. We have partner calls probably every day of the week with different entities, from school nurses, school administrators, colleges, universities, long-term care facilities, home care providers, regularly meeting with them, the Hospital Association, to provide education around that. And then testing, which was a significant. Yeah.
Madam Commissioner, sorry to interrupt you again, but Representative Wallner has a break at 10 o'clock. She's got a question. So I thought I'd give her a chance to ask her question.
Sure.
Thank you, Commissioner, and I'm sorry to interrupt your presentation like that. I'm sorry. I actually had a question back on the staffing page.
Yes.
I didn't get my hand up in time, I guess, while you were on the page. I'm sorry. So when I look at this, it says these are the permanent positions through the governor's phase. So are these the proposed positions for the next budget, the budget we're working on now? Or are these the positions that you have now that are authorized?
Karen, I'm going to let you answer that.
Sure. So it's actually both, but so it's all of our currently authorized positions. And it also is some additional positions, none of which are really new. The only new positions we had this year were conversions, where we converted temporary positions into permanent positions. Those were the only new positions we submitted, and those were all approved. There was, I don't remember the exact number throughout the department, but there was a large number of those at New Hampshire Hospital, which were the positions that will work on the unit that was converted from a children's unit to an adult unit. So those are the majority of the new, and I put new in quotation marks, but new positions that were all conversions from temporary positions to permanent positions.
Thank
I'd like to
you,
follow.
Karen.
Do you have a
Could
follow-up,
I-
Representative Wallner?
Yes, could I just have a quick follow-up?
Yes, ma'am.
So, how many new positions are you requesting in the budget we're looking at now, the next budget?
We actually did not request any new positions. We only requested converting temporary positions.
And could I have
All
one
of
more
those-
question?
All of those
Yes,
were
ma'am.
approved.
Go ahead.
So there are no new positions. Are there any positions that you had in the previous budget that are not included in the next budget?
So there is one position that you will see in HB1 that shows as being abolished. And that position is being replaced by a new permanent position. We needed to retire the position number.
Okay, so for positions, you would say this is a budget that is sort of flat as far as positions go. It's not up or down.
For the most part, we still have about 70-ish unfunded positions throughout the department, but other than that, yes, the positions still exist. They're just not funded.
Thank you. And thank you, Chairman, for letting me ask those questions. And I'm sorry we had to go back.
You're very welcome. They're good questions. I had a similar one on this particular slide. Could we see what the numbers were in the prior two budget cycles? So it sounds like there's not a growth trend, but it'd be nice to see the numbers from the prior two bienniums.
I can do that. What I would warn you of, and anyone that was on the committee last year will remember this, is last biennium, we did a lot of cleanup work with putting positions in the right place. So much so that it was very frustrating for all of us because it was hard to follow where all the positions went. So I would say that the grand total over the bienniums is probably going to be a more helpful number than by division, because the division numbers would have shifted a lot, but I will still provide it that way. Just be warned that it's probably not going to make a lot of sense.
Thank you for that. Representative Erf already warned me that it was going to make my head explode.
And Representative Erf will be happy to hear that there were very few position movements this year. I would say less than 40, which is very low for us.
So if there are no further questions, Commissioner, would you like to go back to where you were?
Sure. So we were on the impact of COVID, and we had talked about the public health response, everything from doing education, case investigation, contact tracing, testing, nursing home investigations, but really a full department response, public health taking the lead on that. The Medicaid caseloads largely going up, and Karen will explain this further down when Karen and Henry, when you get to the Medicaid budget, that the federal government increased our FMAP, which is our federal our federal share of Medicaid, but the requirement in that increase was that we not take anybody off Medicaid during the COVID emergency. So you will see increasing Medicaid caseloads. Every population that DHH serves was affected. You're hearing right now about children's behavioral health and ER boarding. You definitely have heard about our seniors, the nursing home and the homebound that have been disproportionately affected by COVID, having some of the worst outcomes from COVID across the country and really across the globe. That is not a New Hampshire issue. That is really, we're seeing that trend across the entire country. And overall, you know, the impact on isolation is probably the most significant thing that we've seen when it comes to DHHS, and that really crosses all populations, from people with mental illness, people with disabilities, you know, kids not being in school. The impact on that lack of social support, the lack of peer support, and the general isolation that COVID has caused our communities is being felt in every area of the department. And then finally, the budget impact on Alvarez and Marsal. So back almost a year ago, we were facing an uncertain deficit in our budget, and we agreed that we should bring on a consulting firm to look at our department, both operationally and budget-wise, to see if we can find efficiencies. Efficiencies in how we run operations, efficiencies in our budget, and we did do that. And Alvarez and Marsal, or A&M, as we've called it, was embedded in the department for several months and really have been very helpful. So some of the things that came out of that review and what you will see coming through into the budget that you have before you. A recommendation to do an IMD waiver, which is a waiver that allows us to bill for Medicaid for inpatient adults at New Hampshire Hospital. This is very beneficial for us right now. Adults that are in an inpatient stay at an IMD, that's an institution for mental disease, are not eligible for Medicaid reimbursement, which has a 50% federal share. So we will be filing that waiver, hopefully to be done by the end of the year. The other indirect effect of having an IMD waiver is that it allows us to attract and to partner with other inpatient partners. So right now, we have New Hampshire Hospital and some DRFs scattered throughout the state. Many states have inpatient providers that are outside of the state system that run, you know, full psychiatric hospitals. No company is going to be willing to come to New Hampshire without this IMD waiver. So this hopefully is going to be the start of finding a new partner. Representative Edwards.
Thank you. I'm trying to find the most graceful way to interrupt you. We got a question from Representative Urf.
Commissioner, are we going to get a copy of that review?
Yes. I do believe it is going to be released publicly, if not the end of this week, then early next week.
Thank you.
Yep. So that's IMD waiver. Critical time intervention, also called CTI, is something that came out of this review. And what CTI is, it's a evidence-based program for people that have mental illness that is done to reduce readmission rates to hospital. This is something that I'm actually very excited about. Most of you know I am a big proponent of our mental health system after spending a couple of years at New Hampshire Hospital. Critical time intervention is a program that is used in other states that start prior to the discharge from a hospital and goes through 9 months. And it is the fidelity to this program is very important. It is a step down from, right now we have ACT services, which is a very high intensity, labor intensive team approach to care. CTI is probably a step down from that. It is not as intense, but it can be structured to meet any need of a client coming out of the hospital. And what I really love about this program is it requires the community provider to engage the patient and the hospital for discharge from the hospital, which we believe is very important to have a warm handoff or a very smooth transition of care. So this program is going to be really central to a lot of what we're doing this year. We'll be recruiting for CTI specialists. We will be doing certification and training for our state, both state employees and our community providers. I'm very excited about this program. The developmental disability system definitely had a lot of focus in this review. And really what came out of this system, this review, is the ability to structure our DD waiver in a way that better matches a person's needs to their services. And in doing that, ensuring that we have the full continuum of care here in New Hampshire. One of the things that I saw when I was at New Hampshire Hospital, and even as commissioner, is that some of our clients that require the highest level of care, the residential care in a very structured, safe environment that are on the DD waiver, end up needing to go out of state for these services. And it is my opinion, and A&M agrees with me, and I think most of you would agree with me, is that taking a patient that has natural supports in the communities, families, friends, and moving them to another state is not what's best for our citizens. So one of the things that we will be doing around the DD system is really looking at how we create eligibility and structure the system so that we match better what the needs are with what the service is, and then make sure we have all the services in our state. And then one of the big projects that we have going on at the department is MMIS, which is our Medicaid system. This has been on our docket and in our capital budget now for years. I would say several bienniums that we need to invest in the infrastructure of the MMIS system. We are going to start incurring federal penalties if we don't get this system up to date. It is a very long transition. It's probably going to take 8 to 10 years from the time of starting to procure it to having all of the different modular systems in place. So starting that process of really honing in on the MMIS system and getting it up to date and in compliance with federal regulations is going to be a focus. So that ends my overview of what you're going to hear for the next several hours. So I want to stop there before Karen takes over and just answer any questions that any of the committee members may have about the department or what we do.
Thank you so much. This slide does trigger a couple of questions. It sounds like under your new view of how you might change services in the DD area, that there's going to be some fairly rich family counseling to make sure that the needs of the disabled are met. And what I'm curious about is if there's going to be an opportunity to coordinate with other agents that you may be sending into the field to handle other social determinants of health, so that we don't have 2, 3, 4 different client contact points when it would be maybe more efficient to have one. Is that a problem now that we have many contact points for multiple social determinants?
Yes, so it is a problem, and I'm glad that you asked this question, because what you're seeing here is a precursor to exactly what you're talking about, which is full integration of all of our service delivery lines, right? What we want to be able to do is provide whole family case management or care coordination. So if we have a vulnerable family that has someone on the DD waiver, someone with mental health, mental illness, a senior, someone involved with DCYF, that we have care coordinators that can go in and take care of the entire family instead of them having 4 or 5 different touch points with the department. That's where we're heading. The long-term vision is exactly what you're talking about, Representative Edwards, that we're shooting for. And some of the things that we're doing right now and for the next 2 years is teeing that up to look at that integrated model in the department. The journey to get to whole family case management and care coordination, a health home, or some type of model that allows us to take the whole family as a unit versus several touch points is a multi-biennium project. It's not something that can be accomplished in 2 years, because part of the issue is that the department has structured a lot of their programs around federal funding. The federal government funds this part, so we develop a program to capture that federal funding. We need to change that up, but we do need to align the federal programs with our state programs. So this is part of what we're doing to get to exactly what you're talking about.
Okay, so that leads into the MMIS. I had a trivia question of whether or not the master patient index is going to be in there or not, but probably the more significant question is this MMIS going to specifically be tailored so its features support this integrated approach, or are you going to be fighting the information system to help you do the care that you want?
I think that updating MMIS is going to help with the integration of the department overall. I think a specific question to that end is probably best directed at Dave Leaders, who will be on later in the program and talk about MMIS in detail about what we're going to be doing.
Okay, that's fair. I just want to leave you with the idea that I hope if we're going to take 10 years to procure a system, it supports your vision of an integrated family touch point.
I think the best thing about the way we're procuring MMIS is we're doing it in a modular fashion, so that when we change something in our state, we don't have to throw out the whole system. Because it's done in modulars, we would only have to change one modular if we change, even if state law changes or something like that. And that is why, one of the reasons why we're doing this is that it allows for those subtle changes to be made without needing to do a complete overhaul of the entire system.
Great. Are there any other questions? Anyone? So I want to thank you. I want to let you know that if you need some legislative support in your transformation process, that you're seeing some roadblocks to keep you from doing things smarter and making things better for New Hampshire, look at us as allies too, and not just the people trying to cut your budget.
Thank you. Appreciate it.
All right.
Okay, I'm going to turn it over to Karen.
Thank you. So this slide here is really just a preview for what you're going to see from lots of the divisions. And just to hit some of this on a high level, as the commissioner mentioned, the Medicaid caseloads are higher because of the requirements to receive the enhanced FMAP. TANF continues to stay steady. We believe that's partially due to the additional unemployment benefits that are available. Yes, Representative Edwards.
So be gentle with us with your acronyms. Like
yes.
The first, because I think you just stuck 2 of them in my eye right there. So
sorry about that.
Oh, that's all right.
So TANF is Temporary Assistance for Needy Families. It's a program that Chris Santinello will explain in her presentation for the Division of Economic and Housing Stability. That program, like I mentioned, has stayed fairly steady. We believe partially because of the additional unemployment benefits that are available during the pandemic. The same is true of APTD. And I always forget what this acronym is, so I'm sorry. I do know, I believe Kevin provided the list of acronyms, which I'm sure are very overwhelming. I believe it's something like 40 pages of acronyms that we use at our department. So it is very overwhelming, I do understand.
So that's aid for the permanently and totally disabled.
Thank you, Commissioner. I don't know why I always forget that one.
So I
And-
think we're going to have to form the DARC, the Department Acronym Reduction Committee.
And SNAP, which is otherwise known as food stamps, also continues on a downward trend for the last many years. Part of that is related to, if you look at 2017 to 2018, there was an increase in TANF. There was a change in eligibility during the legislative session that increased the benefit and the number of people that are eligible, which also then decreased the number of people eligible for SNAP. So like I mentioned, Henry Lipman in Medicaid will certainly spend a lot more time on the caseloads for Medicaid. Long-term care is what LTC is, and Deb Sheets will cover more of that in her long-term supports and services presentation. And the last three, Chris Santinello will cover in DEHS, which is, I believe, on Tuesday of next week. I wanted to talk to you a little bit about budgeting. Those of you who have been on the committee are familiar with my diagram. This was something that Mary Calise and I created when I came on board to help people understand how things work for DHHS. Because for a lot of agencies, there's just budget and actual. And for our department, there's also something called cost allocation. Cost allocation is a federally required mechanism. We have a what is called a PACAP, P-A-C-A-P, which is Public Assistance Cost Allocation Plan, that is federally required to determine how our expenditures are paid throughout the department. And each of these three things intersect in different ways. Budget to actual, that typically the interaction there is that there is some kind of lapse at the end of the year. Cost allocation to actuals, there are typically adjustments. So we may have budgeted it one way and then later on realize that the earn is a little bit different. And then budget to cost allocation is how we are doing our revenue estimates. And of course, the intersection of all of that is reporting. Just to give you a little bit of an example from cost allocation, we have about 200 different revenue sources in the department. The commissioner, myself, anyone at a senior management level is paid by virtually all of those 200 different sources. So my salary may be made up of, $3 of one type of program, but that is required by the cost allocation plan. The briefing book that the chair was speaking about earlier, I will have that to you, it looks like tomorrow, which is great. But this, I wanted to just give you a sense of what you're going to see in this document. You will see one of these charts here for every accounting unit that is greater than $1 million. So we'll give you the fiscal 20 actuals, the fiscal year 21 adjusted authorized, the agency request for 22 and 23, and the governor budget for 22 and 23. Each of the accounting units also has written information, which includes what I've listed there at the bottom of the slide, the purpose, the client profile, financial summary, which is what is shown above, funding sources. So like I mentioned earlier, it lists that there are many funding sources in the Office of the Commissioner, state mandates and federal mandates, which goes back to what you were asking about earlier, Chair, about which missions are required by law. You would see those for those largest accounting units. The services that are provided, how they're provided, and our expected outcomes. So it's quite a detailed book. I don't remember how many pages it is this year. I think somewhere around 200. Yes, Representative Edwards.
Thank you. Mr. Ripple and I had been talking in background about adding 2 prior fiscal years to it, 18 and 19, so that there's a little bit more of a running trend. to give context to the numbers to the right.
Yes.
How might that happen? Will that happen or not?
Yes, so it will not be in the briefing book, but what I do have for you, and I think we'll have that done Tuesday, if I remember correctly, is I will have a spreadsheet for you, an Excel document. I'll provide it in Excel that has fiscal year 18, 19, and 20 actuals, fiscal year 21 budget or adjusted authorized, and then agency and governor. Excuse me, just to give you a heads up, that is about 3,000 lines long.
Thank you.
Excuse me. So this is meant to just give you a high level sense of the budgets by division. And again, only has 21, 22, 23. The division names I did shorten there just so that we could fit all of the numbers on the page. Excuse me. So starting at the first one there, that's the Division for Behavioral Health. The budget here from the agency phase to the governor's phase actually increased. There was a program that did not get budgeted in the agency phase that was overlooked that the governor kindly added back into the budget. DCYF, the reduction you see here is primarily due to, well, the overall reduction that you're seeing from 163 million down to 136 million is not a reduction to the DCYF budget. We moved the Medicaid expenditures, so kids who are in out-of-home placement that qualify for Medicaid. Previously, we put those Medicaid expenditures in the DCYF budget. To put all of the Medicaid expenditures together made a lot more sense. So those expenditures are now within the Medicaid budget. So you will see that corresponding increase over in the Medicaid budget from that change. Yes, Representative Edwards.
So are you able to move your mouse around to show us what cell you're talking about at each?
Yes, I can do that.
'Cause,
So
yeah.
this 163 million to 136 million here. And the other thing I would mention is this is meant to just be very high level. Each of the divisions, of course, will deep dive into all of these numbers with you. So this, $30 million reduction in the DCYF budget is not truly a reduction. It is just moving the Medicaid expenditures from the DCYF budget to the Medicaid budget, which is down here. So you see there's actually about a $50 million increase, and part of that increase is the 30 million moved. The reduction from the agency phase to the governor's phase was a reduction in funded positions. There were about 20-ish CPSW positions that were unfunded due to vacancies. Economic and housing stability. There's not a lot of change in this budget. There were some minor changes that we can go over when we review that budget. Long-term supports and services. This includes developmental disabilities as well as long-term care. And the changes here were primarily to the developmental disabilities budget, and the director will cover those in her presentation as well. This is the Division of Medicaid Services. This is, of course, our largest budget. I would mention that this does not include Medicaid expansion. This is only standard Medicaid as well as several other accounting units related to Medicaid. As I mentioned, one of the largest increases was just moving those DCYF expenditures from the DCYF budget into the Medicaid budget. There were also expected changes in enrollment. What I would mention, there are two anomalies, if you will, for fiscal year 20 2 in this budget. We have been told to expect the enhanced FMAP to continue through December of 21. So we have adjusted the federal general funds to budget for what we expect will happen there with receiving that enhanced FMAP for those 2 quarters of fiscal year 22. That also means that the caseloads will continue to stay high through those first 2 quarters of fiscal year 22. Otherwise, this is budgeted as though the caseloads go back to a pre-COVID level as of January 1 of 22. But again, the Medicaid budget will go into that in a lot more depth. The Division for Public Health Services, one of the main changes here from the agency phase in, oh, sorry, Representative Edwards, did I see your hand? No, okay, sorry. Division of Public Health Services, one of the changes here from the agency phase to the governor's phase was in the family planning space. There is an anticipated rule change at the federal level where previously there were some family planning facilities in the state that could no longer receive federal funds directly from the federal government, and last biennium had been provided general funds to make up for that. It is anticipated that the rules will change and they will receive those federal funds from the federal government again. So that was a change made in the agency budget during the governor's phase. Glencliff continues to remain steady in budgeting, and there's really no substantial changes in their budget. New Hampshire Hospital, as I mentioned earlier, the largest increase there is the additional positions to fully staff the hospital wing that has been converted or will be converted, in process of being converted from a children's wing to an adult wing. Additionally, the increase here is also related to the PATH program, which is the transitional housing program that we stood up this fall at the Philbrook building. And the last 2, of course, are Office of the Commissioner, the first one being Operations and the second one being Bureau of Information Services, which you will hear from later today. So again, that's just a high-level overview, and I would expect that you will get a lot more details as we go through each division.
It looks like you got one more slide.
I do.
You want to, okay.
So just to mention a few of the prioritized needs, the governor's budget was not able to include any of the prioritized needs that we had, and I just wanted to mention there were some prioritized needs for shelter funds and homeless and housing, a tobacco prevention program, as well as many deferred maintenance items to buildings that DHHS owns and maintains. We have all of our facilities like New Hampshire Hospital and Glencliff, SYSC, which is Sununu Youth Services Center. They all are owned and managed by the department. So there are deferred maintenance items related to those, as well as some operating costs for IT items, which Dave Wieters can cover later today. And Lori Weaver will talk about the deferred maintenance.
So I just want to make sure I understand what you just said. These are things that DHHS says are important, but the governor's budget did not fund.
Correct. That's
okay.
correct.
How much money does that represent? And is it all operational money, or is some of that capital?
Nope, these are all operational. And I don't remember the numbers off the top of my head. What I will make sure to do is provide those to you.
Are there questions from the committee? Representative Bean, were you just stretching your hand there?
I'm good.
Okay, all right. Okay, very
So
good. What's your
if I
plan
may,
now,
if-
Mr. Ripple? Go ahead.
If I may, if there are any other questions for the commissioner, I would just like to give you all the opportunity to ask her those now related to the department, as she will probably jump off after this, and Lori Weaver and I will be picking up.
busy. I understand her need to go, and if we need to get hold of her later, I imagine she'll take a phone call or an email. So,
Yes, email is probably best way to reach me, as I'm not picking up my voicemails as often as I can, because I'm up at the Emergency Operations Center at least half of the week, so often not in my office.
thank you. Appreciate it. Are there any questions for the commissioner? All right. I don't see any.
Thank you so
Thank
much.
you. So Mr. Ripple, help me here. Or is this where we're supposed to go through actual spreadsheets and budget line items, or are we supposed to go to the next speaker?
Well, I think at the moment you'll go to the next speaker, and there's a division presentation that Karen and a few other people will go through. And after that, you'll start going through the budget pages for that division.
Okay. Let's do that.
So do I need to bring over a few more people for this, Karen?
Yes, I believe if you could bring over Beth Kelly and Landry,
Okay.
those would be the two for now.
Okay.
So we've been going for an hour. If anyone needs to take a quick bio break, there's a transition here. Otherwise, we'll just keep on going.
All right. All right, I'm going to go ahead and turn things over to Lori. Lori, just let me know when you would like me to flip slides.
Morning, everybody. Thank you, Karen. My name's Lori Weaver. I'm the Deputy Commissioner of the Department. Operations is one of the primary things that I deal with every day. I think, Karen, if you flip to the next slide, I can set the context for this deck, and then I'll turn it over to you for the finance.
Wow, 61.
If you can.
Oh, I'm sorry. I'm not on mute. I just looked at the 61 slides and reacted. Sorry.
That's okay. I said the same thing when I finished the deck.
I'm sure every slide is exciting.
Yes. Well, I'm going to get rid of another slide for you, Karen. If you can go to the next slide, I think it would be more specific. So the way the prior deck that the commissioner just went over, there was a slide that had colors on it, and it had the different chunks of the department. And primarily, we look at that not as an org chart, but of all the programs and services that the department offers, so that if anyone from the outside, not in the department, wants to say, hey, where can I find Medicaid? Where can I find food stamps? They would be able to look at that. So it's a way that we sort of organize ourselves to make sense to the general public, because it's a large department and it's complex with all of the various components. So you will be hearing over the next couple of weeks from divisions. As Karen mentioned, we have Economic and Housing Services, you have the Division of Children, Youth and Families, and so on. We also have our administrative operations sort of get lumped into what we call the Office of the Commissioner, or OCOM as it's commonly referenced in the acronym world. But OCOM consists of the pieces that you have here in this deck, which we're about to go over, which is finance and our contracts unit, our human resources, our employee assistance program, our facilities and maintenance, talks a little bit about our district offices in terms of how those services are laid out, our Office of Health Equity, and then in addition, you have your Bureau of Information Services with Dave Wieters, and you have Meredith Telulus with Program Quality and Integrity, as well as legal services. So that's sort of the high level of the OCOM and how we clump together. The ones that I'm about to speak to in this deck, and Karen's going to start us off with finance and contracts, are a little bit smaller than the larger divisions. So we thought it would be easier, more palatable to be able to present it to you in one deck. So even though there's 61 slides, Representative Edwards, there are a couple of blank slides which sort of separate out sections. So the first section that we have is a high-level overview of the finance and contracts unit. I'll turn it back over to Karen to take us through that.
So what I wanted to mention, and Chair, you mentioned this earlier, that you had sent over a list of questions that you wanted to make sure that we answered. And we made sure to incorporate those in our slides with a few exceptions. And I wanted to walk you through what some of those exceptions are. First of all, succession planning. Lori Weaver is going to talk about succession planning at a department level a little bit later in the slides. So we won't be covering that in each of the presentations. Litigation will be covered by Melissa St. Cyr, who is our Chief Legal Officer. She will cover litigation for the whole department. So again, litigation will not be in each of the presentations. And then audits of the department will be covered by Meredith Toulouse and a little bit by myself later, again, when she presents, and she will cover that for the whole department. Additionally, you may see slight variations in slides as some things were more applicable than others. For example, here, as I go through my slides, I'm talking about one accounting unit that has all of the accounting, finance, and procurement contract staff in it. So it's a much smaller accounting unit. And of course, our mission is fairly clear. So from a introductory perspective, there are two people who are key people for me in finance and contracts, and then there are several people who are secondary key, if you will, you will meet over the next several weeks. Which reminds me, Kevin, if you could please bring Mary Calise over as well, because there may be times that I need her. And I apologize, Mary, for not mentioning you from the beginning. So as I mentioned earlier, I have been CFO of DHHS for about 3 years, and I previously worked for the Department of Revenue Administration for about 10 years. So you will see that I often still have a keen interest in revenues for the state. Mary Calise is my deputy CFO. I do not operate without this person. She is amazing. She has been with the department for 25 years. There is not much about the department that Mary does not know. Her historical knowledge is critical for us. Nathan White is our Director of Contracts. He's been with DHHS for about 3 years. Previously, he worked for the LBA, and you will see later that there are many accomplishments that he has since he has been working for the department. I look at our division of finance broken into 3 groups, but technically we are 2. There is finance and there is contracts. But within our finance team, there are 2 types of groups, if you will. There's what I would call the expenditure group. So each division, including Office of Commissioner, has a finance director, or what we sometimes refer to as a budget team member. In this case, for Office of the Commissioner, that's Beth Kelly. That was the other person that I asked to be brought over. So she manages the day-to-day finances for the Office of the Commissioner. The largest budget, of course, is Medicaid, but the largest number of accounting units is public health. So we're very variable in what our finances look like. And that last box I should have deleted. I apologize, that came from a template and is not related to the Division of Finance. The revenue reporting and grants management. So a couple of years ago, we established a position to oversee all of the revenue after an audit finding in 2019 that recommended that. We've not been able to implement all of our plans around that position due to COVID and the hiring freeze. However, we have changed how we have budgeted over the past 2 years. And the Finance Committee last biennium heard a lot about this. We now budget by revenue sources. So there was a time back that Kevin will remember very well when somebody would say, could you tell us where every TANF dollar is budgeted? And we would say, no, we can't, which was not great. And last biennium was the first time that we were able to provide that. And Mary and I were both a little bit sad that Neil Kirk was not around for us to present him that, because he had been asking for many, many bienniums to see exactly that. And I do believe that I asked Representative Urf to tell him about it. So that was an exciting change for us. It has been a change in how we do our work, but it is going well, and we're going to continue to move to do that. This group is responsible for filing more than 200 expenditure reports every year with our federal partners. And they're also responsible for maintaining our federally required public assistance cost allocation plan, which I mentioned earlier. A newer part of this team, which is also really with the contracts team, but works very closely with our revenue team, is grants management. They are working to establish policy and procedure for grants all across DHHS. And this is actually an area that we work very closely with Meredith Toulouse on. And when you hear more about her division, you will understand why there is so much relationship between grants management and contracts and the work that she does. Our contracts division, of course, is in charge of facilitating all of our contracting services, of which we have many. We typically have anywhere between 800 and 1,000 active contracts at any given time. During COVID, that almost doubled. So the contracting work over the past year has been quite high. I believe Nathan testified yesterday to a Senate committee that virtually all of his staff have been working full-time overtime for over a year with very little vacation time. So it has been a strain on that team. They are also organized in teams that are assigned to each of the divisions. And as I just mentioned, the volume has increased 113% since 2017. The largest increase due to COVID. Over 400 contracts have been related to COVID.
I have a question for you on that slide.
Yes.
Okay, I just want to make sure I understand. If you have, I assume you have lawyers in that group, and that when you guys do a contract, you are the contracting office, that you are the ones that obligate the state legally to the contract, that there isn't some contracting office somewhere else in the state. You guys are writing your contract.
Yes, so there is an attorney that works within the contracts division that assists with anything that's related to legal work. In addition, that team does also work closely with Melissa St. Cyr, especially as it's been relating to COVID. They also work with the Attorney General's office. The Attorney General's office reviews many, if not all of our contracts and our larger RFPs. As far as who signs the contract, that's typically whoever the commissioner designates to be authorized to sign the contract, which is typically only division directors. So the contracts unit staff themselves do not become the signatory on the contract. It's typically the division director that's the signatory.
So if I ever got curious about an RFP we've released or a contract we've signed, I would contact Ms. Weaver. I would contact Mr. Ripple, who would get to you. How would we do that?
So probably the best way is to work through Kevin, through Mr. Ripple. He would reach out to me, and I would work with Nathan White, who's the director of the contracts division, and the division director who manages that contract. So it would probably be more than one person, depending on the question. So the easiest way to save you from having to reach out to 3 or 4 people is to do that through Kevin. Some of our accomplishments, the contracts division under Nathan's direction has improved their process greatly. They instituted a forecasting system in fiscal year 21, and they also rolled out DocuSign during COVID, which was necessary because there were not people to come sign the contracts in person, and also reduce the workload incredibly. So initial data is he's seeing a 53% reduction in cycle times for the execution phase of the contracting process, and a 10% reduction in cycle times for the entire contracting process. which is quite amazing. And quite frankly, the only reason why that team has not, why that team has been able to survive through COVID is because he has managed to put efficiencies in place to allow us to continue to work with the same amount of people while increasing the number of contracts. They also substantially reduced the number of retroactive contracts from July 18 to March 2020. You'll notice that that does say March 2020 because as soon as COVID happened, virtually every COVID contract is retroactive. So that has impacted the retroactive percentage greatly. However, we do expect that post-COVID, that rate will continue to decline. Yes, Representative.
So are we having to pay a premium for these contracts because we had to go retroactive? Or are they still coming in at the expected costs?
I think that they've still been coming in at the expected cost. So having been at the Emergency Operations Center since March of last year, I was part of a lot of those discussions with the commissioner and contractors. And I believe that even though we had to make decisions in a matter of days, sometimes hours, that we still worked really hard to make sure that we were getting a reasonable rate and not being taken advantage of.
Thank you.
As we discussed yesterday or an hour ago, we have changed the way we work on the budget to look at revenue and complete monthly projections. And our current project for the division is rewriting our policies and procedures. And the last accomplishment I wanted to mention is that we have created a finance academy to create training modules to ensure staff are onboarded with basic information. And we're working on the future models, which will ensure knowledge transfer and that more than one person can perform specific work or succession planning, if you will. So that's an exciting project for us. One of the things that you asked for is what would happen if the budget was increased 5% and what would happen if it was decreased 5%. So for starters, if it was increased 5%, we do have 8 unfunded positions in the Division of Finance. So that would be my first priority, would be to fund those 8 positions. The second thing I would look at would be additional software to support the contracts process. There is some software out there that could make us even more efficient. So that is something that I would certainly look for or look at. And then of course, additional positions, because as you look at our budget, you will see that we are mainly made up of positions. And what would happen if the finance budget was reduced? We would have to reduce the number of positions that were funded. Yes, Representative Edwards.
So I would be interested, not urgently, but I'd be interested in this software to support the contract process.
Okay.
If we can work with you to find ways for you to gain efficiencies, I would like to see if we can support that.
Sure. What I will do is I will have Nathan White put together something for you on that and send it over.
I'd be interested in what features or functions we don't have now that we would be obtaining with different software.
Sure. Yes, I can absolutely get that to you. So as I mentioned, there in many of the other presentations, there are additional slides, but they were less applicable to my division, so I did not include them. So the last slide you will see in each section, and when we get to like Division of Behavioral Health, this is at every bureau, is okay, now here, oh, I'm sorry, this is actually positions. Sorry, I'm jumping ahead a couple of slides. This is positions, so there are 144 positions in finance. What I would mention is that the finance teams at New Hampshire Hospital and Glencliff both report to the CFO of New Hampshire Hospital, who is Joe Caristi. You will meet him the week after next. He reports to me as a dotted line because of course their finances are still part of the department and I am still responsible for the finances of the entire department. But those finance staff, because of the nature of working in a facility like a hospital, they do report to the CEO of the hospital and of Glencliff. This is to just give you a sense of the federal funds and general funds. You will see this slide in all of the presentations. 20 and 21 looks a little funny. And the reason for that, that green block, is other funds. And if you have been watching the press conferences by the governor, you have heard that New Hampshire has been helping the VA, the US Veterans Administration, acquire PPE, which is personal protective equipment, although I think everyone knows that acronym by now. Thank you, COVID. And so to do that, the department both purchases as well as receives the reimbursement from the VA. And we did that within the finance accounting unit. It was just a good place to put it. We created a class line, and that is where those funds flow in and out of. And so that's why there's this weird anomaly of other funds. Otherwise, you can see that our general and federal funds are pretty steady from 18 to 22, 23. And here is what I was mentioning. This last slide is where we will list the accounting units related to the section that we just reviewed, as well as the budget book page, which in this case is 1162, which Representative Erf will remember well, is not the PDF page, but the page on the budget book. There's also the briefing book page number on here, which you will have tomorrow. So you'll be able to refer to page 231 to see the detail on that accounting unit. So this is where I would ask the question, whether you would like to look at this accounting unit now, which I can actually pull up and screen share, or if you would like to go through more of the OCOM presentations and then come back to look at the detail.
Let's defer looking at the detail until we can just go through it.
Okay, so from here, I will go ahead and turn things over to Lori Weaver.
Thank you. Kevin, may we bring in people from, you say the other side, it makes me think of the dark side with Star Wars. Can we bring in people from the folks listed here, Stacy Silva, Paula Booth, and Dave Clapp?
Sure.
Thank you. As Kevin is doing that, I could probably get started with a couple of things. I did want to just go back for a second, Representative Edwards, on your comment about the software for the contracts unit. I would also recommend that you ask that question to the Department of Administrative Services, who has budgeted and been working on procurement of a statewide procurement purchasing system for all state agencies. So they would be able to advise you where that's at. We have been a part of that. There's been a challenge, I think, for us because our department is so large and so complex. Some of the things we had a little bit of issues, and Nathan has done a phenomenal job of working around while we wait for that system to get things done. So I just make a note of that. There is more about that Commissioner Arlinghouse could address. Kevin, do we have everybody? Yes. Is Paula Booth? Oh, there she is.
I think you do, yes.
Thank you. We're going to start out with human resources. And one of the slides that Karen had mentioned, that what we decided to address on a more global level was succession planning. And that I will address that in this section. My name's Lori Weaver. I've been with the department for about 24 years now. Currently Deputy Commissioner. I've had various roles within the department in that time, mostly all in director leadership or associate commissioner roles during that time. Stacy Silva, who's on the panel here, as well as our recent human resources director, our director of 21 years, just retired last December. Great for her and not so great for us, but we found Stacy Silva, who has been with UNH for 25 years as our HR director. So it was a nice transition for Stacy to step right in into our system and keep us moving. We have Paula Booth, who is our employee assistance program director. And we have Dave Clapp, who's our facilities director. So as I go through these pieces, if there's any questions that I can't answer, I may ask them to jump in, but I hopefully can answer them. In terms of succession planning, many of you are aware that we operate in a unionized environment, which provides some challenges for us. We're often told that we can't use the word succession planning. because we cannot target people for jobs because we have to post our jobs and give fair and equal opportunity to all who certify for any job that they apply for. So we talk more about our bench and building our bench, and looking at having people that could apply for those positions when key leadership and other positions vacate or become vacant. I will tell you that our plan right now after 2020 is to try to fill those 765 positions. We have been decimated by COVID with our workforce. We had a hiring freeze that lasted 9 months. So when we have as many programs and services that we have and we're down 760 positions, it hurts. It hurts a lot. So Stacey's got a heavy emphasis right now that the hiring freeze has been lifted, on recruitment. Get folks in the door. Let's beef up our staff, and then we will focus to that retention strategy to obviously have people stay and grow within the department. So we have a benefit, I think, because we're such a large department. You could come in virtually in any division, maybe spend some time there, and then you could grow and transition to another division. So we are retaining you as a department employee, but you're getting a skill set. Maybe you're an adult and elderly services worker, or you're a child support worker, or you're a child welfare worker, or you work in finance for Karen Rounds. There's plenty of opportunities. So heavy emphasis on professional development, not only paying for classes when it's appropriate, but also providing our own internal training programs. Yes, Representative Edwards.
So Ms. Weaver, I'd like to know what you're thinking about the onboarding of that many people in an era of COVID and social distancing. It just seems to me that the traditional ways in which large organizations have brought people in and gotten them to understand the culture and who's who and who they can trust and who their peers are, all of that is out the window now in a Zoom world. So I'm just curious, if we go on a massive successful hiring rampage, how are we really going to integrate those people into your organization in a way that's effective and doesn't cause people to just get upset and leave?
Yeah, it's a great question. I'm glad you brought it up. It's what we've been working on during this whole time of COVID from a human resource perspective, is how do we allow people to work remotely but stay connected, right? That's been the big challenge for us. I will tell you, 50% of our workforce is direct care. It is those caseworkers out in the field. So our numbers are fairly good in terms of, we have a 20% vacancy rate overall, but in terms of our service areas, we're holding steady. We've had to recruit people during the time of COVID, and it has been extremely challenging. We've had to change practices. We've had to take on safety measures, and really, it's like a paradigm shift, right? Everything of the way that we have done it has changed. So in terms of right now, we're probably one of the state agencies that have the most people actually coming to work with restrictions. We do have a fair amount of our workforce working remotely. We have such an innovative team at HR. We had our organizational development administrator. Basically, her focus was, your job is to keep people integrated during this time of COVID. How do you teach people to be connected on Zoom? How do we onboard? How do we orient? You'll see when I go through some of these slides, I'll give you some numbers of how many face-to-face orientations we had before COVID hit, and then you'll see everything after that had to be virtual. How do we keep those people connected? So we are finding extreme innovative ways to do that. I think, as the commissioner mentioned, things are winding down a little bit with COVID. If we can get to a steady state and folks are getting vaccinated, it is our intention to find the balance of who can stay working remotely and who should be coming back in the office and keeping those connections. So it's a day-to-day challenge that we're working on right now. So I appreciate the question. Karen, if you could flip the slide, please.
Lori actually just gave you control. You should be able to go to the next slide.
Oh, I have control. Oh, that's awesome. What do? I just click it? Oh, yeah.
Perfect.
Great. Now, if I could just keep it to stay on one slide. Hang on. I don't know where I am. What happened? All right, here we go. So for our mission of human resources, basically our human resource looks to be a business partner with all of our program areas to be able to help them recruit and retain, develop staff, grow staff, be invested in staff, and have staff be satisfied and want to stay in their jobs and grow with the department. Our vision pretty much is sort of what I was just speaking to, is to be able to be transformative about how we do our business. One of the challenges with state government is that it's been sort of rigid and or inflexible with some of our ability to do things differently. COVID really forced our hand on that and showed us that we could do things differently and we could still be as effective, if not more effective. So that's going to be a big focus for us moving forward. These are the key, when we look at HR, we look at, obviously we have recruitment and retention, we have our payroll benefits piece, we have our organizational development training, which is really getting in and working with work groups to become more efficient and more effective at what they do, and obviously training. Our workforce development, how many positions do we have? Do we have the right number of positions? Are they in the right area? And growth, as well as employee relations. You can't have a large organization without continuously managing employee relations. They're in a circle format because each informs the other. So as we learn about what kinds of issues employees may be having, we look at how can we help train? How do we train supervisors? How do we train staff to sort of mitigate what those issues might be? So this sort of all work together for the various components. We have, I think it was 3,200 something, 3,260 something positions that was in the slide deck that the commissioner was on. That breaks out to about our workforce spread out over 11 offices throughout the state. So you'll see 1 through 11, that's what we call our district offices. So we have all of our program services are offered through that for catchment areas, as well as administrative services as well. We also have what we call the SOPS campus, the State Office Park campus, which is up on Pleasant Street. We have a bunch of office buildings there, as well as Hazen Drive. We have our public health is over at Hazen Drive. And we also have 3 24/7 facilities, which is our Glencliff home, Sununu Center, and New Hampshire Hospital. So all of our approximately 3,200 staff are spread out in those locations. Questions? Okay. This, I'm not going to go through each line here, but this will give you an idea of the volume that our HR experiences in terms of new hires and transfers and training seats. We have a pretty robust supervisory offerings where we have a certificate program, we have a training series, we have a roundtable. Representative Edwards, that roundtable was in response to COVID for a way to have supervisors come together once a week and talk about the challenges that they were having in a facilitated training environment. It's been very, very successful and it's scheduled to continue. We had about 12,000 applications over the last year. You can imagine one unit processing that many employee applications is quite a bit. We established 122 positions. Oftentimes, many of them are temporary or permanent positions, depending on what the need is. Redesigned onboarding to a virtual platform in response to COVID, and provided support to 2,752 DHHS managers. So quite a busy department. HR was instrumental in not only helping us identify for COVID, there was a call that went out from Employment Security or from the governor's office in terms of volunteers, and our HR helped coordinate who are those folks going to be in human health and human resources that could step up and help meet that need, as well as help with all of the procurements that needed to happen in terms of staffing and augmenting staff. So there's a list of accomplishments here, but I think even just the first 2 boxes speak to the volume that happens within our HR. Some challenges, I think we've sort of talked about them, is that modality shift for the new employee orientation and shifting to that virtual platform. The collection of documents when you're hiring somebody new for COVID was challenging because we couldn't have that face-to-face, and how were we going to do that? Our hiring process also took a little bit of a change. So I'm sure you're well aware that the Division of Personnel, which sits at Admin Services, is sort of the mothership for all of the state agencies. So they can give us direction and we have to follow it. So they actually made a change to the hiring process, which actually made it a little bit more challenging for us to meet our goals. So that's been a challenge to try to meet those requirements. We're doing it, but it's a little hard. As well as working out how do we figure out our workforce that's out there working telework. How do we know they're productive? What is their output on any given day? Our services being delivered. We spent a lot of time working with HR in our program to be able to document actions of our staff and to be able to show that staff were producing, staff were staying engaged, and staff were getting trained. So our key leadership, Stacy Silver, who is on the line as our director. We have Heidi Jackson Ryan, who oversees our benefits and payroll, and that does include our FMLA, Family Medical Leave Act, and ADA accommodations. Lori Spring is our workforce development coordinator. Rob Berry does a lot with our ADA and accommodations. And Virginia Lever is our ODTS administrator, organizational development and training services person, and Erica Kelly helps with recruitment. So that's our leadership team in HR.
Quick education question there. As I look at numbers, is New Hampshire's style that the bigger the number, the more senior they are, or is it the opposite, where the lower the number, the more senior they are?
When you're referencing number, what?
Like administrator 2, would an administrator 2 be more senior than an administrative 1, or vice versa?
Yeah, so the classification is so if you take the first two, right, one would say, oh, assistant administrator, is that higher than an administrator 2? Actually, an administrator 2 is higher than an assistant administrator, I believe. So it goes 1, 2, 3, and 4. There is a series for the administrator, as there is for supervisors and other positions.
All right, kind of like the military, the bigger your number, the better. Got it.
Yeah, and then if you don't have a number, I don't know what that means, but but these are our classified positions here. Actually, the director here is an administrator 4, so that does answer your question. Moving on to some benchmarks. So in person, 92 new hires in January and February. So that was before COVID hit. And then after COVID, we had 394 new hires that came through that we had to find another way to do that orientation. And I have helped assist with some of those orientations via a Zoom platform in terms of welcoming people to the department and connecting them to something larger that they're not in person at. So that has been a challenge, but I think we've done a pretty good job with it. As I mentioned, we had the 12,000 applications. Now, some of you may cringe when you see this next one. Average 55 days to fill the position from posting to hire, right? Wow, that's terrible. How can it take 55 days to hire somebody? Well, when you compare it to, it was about 90 days before, so there's improvement. That 55 days is often some of the bureaucracy that goes with trying to hire in state government in terms of paperwork shuffle and different components. So we're constantly trying to use a lean process to get that number down and to get people on board quicker. And we're not alone. You'll find that every state agency faces the same challenge. And we trained 1,120 employees for last year in COVID. Most of that was virtual training, which folks actually showed up for because there was this element of people wanting to stay connected. We want to stay connected with our coworkers. We want to stay connected with our office. We want to stay connected with those that we serve. So we saw people making a real effort to stay connected. When we look at what would we do if we had 5% more or 5% less, obviously we would do more of training and development. We have some initiatives that we would, consider launching. But I think going back to the theme, you're going to see a theme here when we talk about information services, not only the software systems, but also the hardware. We're lacking in this area as well. We have to rely on the state system, which is okay, but it doesn't meet all of our needs when we're talking about HR metrics. And so we have to do some of our own calculating of those metrics, which, we would be great if we had a database software to be able to help us do that. And if we didn't have the 5%, obviously we'd have to look at a reduction in force and less training and less services, and delayed response on some other things because we wouldn't have a lot of staff. I want to always stay in the 5% more. I get really worried about the 5% less, but let's hope it doesn't happen. We have about 30 positions. So if you think about that picture of the state, and I had all of the areas where all staff are, so we've got a infrastructure support of about 30 HR staff and various components supporting that workforce.
I have a question on that slide, the one you just showed. Do you know if there's a national benchmark for how many HR staff there is needed for like every 100 employees? Are you comparing this to a benchmark, or is this just sort of what we've thought we've needed over time?
I'm gonna do two things. I'm gonna tell you what I know, and I'm gonna ask Stacy to unmute and ask her if she knows if there's a national benchmark. I can tell you that in the 24 years that I've been here, this number has been between 30 and 35. I haven't seen it go above that. I have seen it dip below 28 in times of reductions. But Stacy, I don't know if there's a ratio for workforce relative to HR staff. Kevin, can she unmute herself? Or?
I can.
Okay, thank you.
Thank you for the question. In the past, we've always used the benchmark 1 HR professional for every 100 employees. That has slightly shifted over the years, partly because we are moving to a telework environment, but that has been the benchmark previously. I'm happy to do some additional research if you'd like to get an updated number.
I'd say you're going to have a lot of places to put your energy. I just like hearing that you all are looking at external benchmarks and comparing yourself so that we are rationally growing or reducing. So thank you.
Thank you, Stacy. I have no green in my budget comparison. I only have red and blue. We have general funds and we have very little federal funds. HR is primarily federal, general funded. And I think that my accounting unit. So these would be the corresponding numbers for the budget book and for the briefing page. And that wraps up the high level of human resources. If there are no questions, I can go on to the next group.
I don't see any questions. Anyone on the committee have a question here? All right, I'm not seeing any, so go forth.
Okay, great, thank you. So our next program is from the Office of the Commissioners, the Employee Assistance Program. This program basically was born and grew up in the Department of Health and Human Services. And I am proud to say that we have Paula Nadeau Booth as our director for the last, she just celebrated her 31 years, Paula, 35, okay, right, it was 35 years with the department, 35 years, that is wonderful. So Paula has taken the program from infancy all the way up to where it is today. It serves, the thing about HHS, EAP, is that it actually sits in Health and Human Services, but it services all of the state agencies. It services the judicial branch, the governor's office, and in some case, in the courts, and in some cases, municipalities. So we're talking about a program that spans pretty far and wide and has a staff of 6. So this group does EAP traditionally provides counseling services, sometimes short-term counseling services for our staff, right, for our employees. We often unfortunately have tragedies that occur. You may remember the motorcycle accident that happened up in the North Country a couple of years ago. A lot of folks getting called to that. EAP was also called to that to assist. If there's an employee death in the workplace, and unfortunately that does happen, and there have been quite a few in HHS over the last couple of years, Paula and her team will come in and support the team with grief counseling. There are all kinds of issues that happen in the workplace. EAP will come in, be able to provide some short-term, meet some needs. And if it is required for more, they can refer out for a behavioral health referral as well. So well-utilized program. These are the, I got a little bit ahead of myself. These are the various components of it, which is the individual and counseling, the crisis intervention, which is what I was mentioning. And they also do supervisory and management consulting. So often Paula will be called in to work with various leadership teams, leaders, and oftentimes commissioners as well. It's a resource available to anyone in state government that is part of the system. It's a cost allocated system, so every agency pays in a proportion based on their staffing to receive the services. Over the last year, they've been very busy, as you can imagine, with COVID in terms of providing training and providing support. The governor recently launched back in January of 2021, the Respect and Civility in the Workplace. EAP was at the table from its inception. That was about a 2-year project. It was really beefing up an existing program that we already had, but Paula's team was a big part of that. And also, one of the neat accomplishments I think that's on here is this last bullet is to provide some peer support programs. Paula's team is involved with not only HHS, but Department of Safety for some peer support groups and some things that happen there to be able to have a facilitator and work with the group, as well as DCYF. We know that our caseworkers face a lot of trauma, see a lot of trauma every day, and there's an opportunity to also take care of each other through the peer support groups, and their group helps with that. So some neat accomplishments over the year. Some challenges, okay, here it is again, lack of a contemporary data collection system, right? So how do you improve program without consistent data telling us where we need to go? So Paula and her team have some systems, but they're not where they need to be. So we are looking to try to be able to have one platform, something like Salesforce, to be able to use an existing platform where we could get some data that would help drive future programming, but that is a challenge currently. Second challenge is just the lack of resources over the time of COVID. You've probably been reading in the papers that there are counselors are booked solid. They don't have openings for months. So if Paula's team is going to hand off a referral, sometimes it's hard to find a behavioral health provider to take that on. And I think providing services to a remote workforce was definitely a challenge over this last year of staff that needed the support, but maybe could only do it in a like a telehealth capacity. Which is not the same as being in person. Yes, Representative Edwards.
I just want to do a time check here. We've got a lot of great slides ahead of us. Do you have a projected time, if we don't interrupt you, how long this might take?
And how fast I can talk? I could probably get through this through facilities in the next 15 minutes, turn it over to Ann Landry for the last piece, maybe be done in the next half an hour. Does that work?
Okay, I would like to target being done by noon so that we can take a break at noon and maybe
sure.
just a 40. Yeah. All right. Thank you.
So here we have the team. I think what I'll point out for time purposes here is that we have a lot of longevity from our counselors and Paula and her team. As I mentioned, Paula's been here for state service of 35 years. So we have a really solid group of counselors on Paula's team. Some benchmarks that they were working on in terms of time in COVID. I think I've spoken to a lot of these in terms of how do you effectively communicate in a telephonic kind of, not telephonic, but a telework kind of world. Providing interventions and working with employees that are currently in the workplace or having issues, and the clear clinical and peer support that I've mentioned. So if we're looking at our budget in terms of where we're looking at, we could always use more staff to help. The need is always there. The data management system is something we would like to procure when we're trying to do that now, even without the 5% increase, just to try to find a way to fix that system. And then obviously there would be an impact on decreased services if we had to make some cuts. So we have 6 full-time staff for all of the services that I mentioned. And pretty much they're primarily generally funded as well, although there are some other funds in here. Lots of other funds. And then Karen, there's no briefing book page number on this slide, so we'll have to get that updated for you.
Yes.
Okay. So that concludes EAP. If there aren't any questions, I'll go on to facilities.
I had a question. It looks like overall, we're probably spending about $75 per state employee on an EAP. If my math is right, do we have a benchmark for EAP to compare ourselves to?
So we don't the way that we do the cost structure for the funding is actually, it's actually a lot less than that per person. It's based on number of full-time and part-time staff that an agency has. The formula for it. I think we were down, Paula and Mary Calise is on the line, correct me if I'm wrong, but I think we were between $25 and $35 per person.
Yes.
Because we offer that as the state service representative, I don't, in terms of the comparisons, a lot of other states outsource their EAP with a vendor that's not necessarily in state. So I think one of the reasons why we can do it for less is because we offer it as a state service.
May I make one comment?
Please.
The other part of it too is because we are within this closed system, so to speak, we've been able to expand the services that this program offers to all 3 branches of government. And so when you want to compare apples to apples, very often an EAP program outside the state system would be a 1-800 number where somebody might call and get some suggestions. We are a hands-on, on-site program that really has been able to morph based on the culture within which we go into. So what we do at the prison in Berlin is different than we would do for the general court, which is different than what we would do for DCYF or state police. So we've had the good fortune, because of the support of all the agencies, to really make this a model program for other EAPs as well.
Thanks, Paula. Any other questions before we wrap up EAP? Okay, let's move on to facilities. We're on 36 of 61. We're halfway there. We have a bureau here, facilities management, that is put together with our office services. So some of our inventory and purchasing unit. Basically, this group, for all of those properties that I shared in the slide, is responsible for most of the maintenance in that group. Our district offices, the landlords are responsible for a lot of that maintenance, but for the SOPS campus, the Hazen campus, and our institutions, facilities oversees that, which comes up to about 25 lease spaces, about 2,225, 560 square feet of office space for approximately 1,100 staff. How that breaks out. So it's quite a bit of property to oversee. We have our facilities and maintenance that I mentioned. Sununu Service Centers is about 150 acres with 13 buildings. Glen Cliff is 70 acres with 22 buildings. And also, who am I missing? New Hampshire Hospital is right here on campus with 1 building, but with many needs. So our facilities folks are out there working on a multitude of facility issues, as well as designing new space. You've often heard about different initiatives of building things. Our facilities unit will work on being a part of that team. We also have what we call facility coordinators, who are in these regions of the state, who are our logistical and facility support of a link back to any needs that they may have. So we have 11 district offices. We have 3.5 facility coordinators. So we don't have enough staff to cover every office. They were cut many years ago. We have not been able to get positions put back in the budget since they were cut, although there is a need. Couple of questions there. Yes, who would like to go first? Representative Earp?
Representative Earp, you're recognized.
So I'm guessing many of your folks are working remote these days. And I'm wondering, which means a lot of your buildings are empty. And I'm wondering if you've considered, as I think many other companies have started to consider, staying on that model going forward and starting to reduce your actual physical space and leases.
Yeah, so just a couple of things on that. We actually do have staff in our buildings. We have taken all of our buildings and with the appropriate social distancing measurements and seats have determined what our capacity would be. So we do not have 100% remote workforce. We've probably reduced at least 50%. So we do have about half working at home. That said, one of the things that we learned is that we could keep some people at home. So how do we reduce our brick and mortar? So we have long-term leases with the district offices. So as those start to come up for renewal, we're looking at reducing that footprint and finding a smaller space, absolutely. But I just want to be clear, our facilities people have not been remote. They have been frontline and center of cleaning and having to be if there was any sort of COVID exposure or any need. So I just want to share that there is a perception that all state employees are remote and they're not. And these guys have been our frontline heroes. Go ahead.
Could I follow up?
Sure.
I didn't mean specifically the facilities people. I meant the people in the facilities.
Yes, I know. It was my opportunity to share that too. I agree. But your point, well-being, yes, we are trying to reduce our brick and mortar for sure. Yes. Representative Edwards, did you have a question or were we just recognizing Representative Earp?
I was just recognizing him.
Okay.
Kind of goes with the territory.
And last thing on here is just office services, which is your basic fleet management, logistics, purchasing, inventory, archiving, and mail services. So all of those are in our facility area. So I was talking about this a little bit. We did have a lot happening with COVID, setting up COVID tracking sites, vaccination sites, procurement, warehouse space. Where do we put all this PPE? We don't have enough warehouse space. Facilities was front and center in helping us with that as well. One of the biggest accomplishments is the PATH program that's here on State Office Park South. That is, Commissioner Shibanet was referring to that earlier, where we increased our transitional program for psychiatric adults coming out of New Hampshire Hospital, being able to have a step down here on campus into the Philbrook building. And facilities in about less than 4 months was able to make that happen. They were able to remove the tenant, renovate the space, ready it for occupancy, and then get patients in there. So it was a huge accomplishment. Emergency repairs to Glencliff and Sununu Center, who Glencliff is pretty self-sustaining, but they do have a lot of needs when things break, as well as Sununu Center. We replaced our automatic mailing system, which is was a big deal. It took a long time to get the money to be able to replace that system, and we finally were able to do that last year, as well as the fuel delivery system at the transportation garage. So they've been busy. Similar way that we break it down in terms of field, these are our offices, as I think you've seen this slide before. We have 3.5 facility coordinators for those 11 offices. Some challenges, you're going to hear this probably repeatedly as we go through the budget process, is just funding. We are not really funded, I would say 100% adequately to complete not only the ongoing maintenance projects, but also our capital projects, maintenance projects as well. It's been, there's been a lot of deferred maintenance, and we're sort of at a breaking point for some of our buildings, some of our properties. Commissioner Arlinghouse says, is it a 2-bucket leak or an 8-bucket leak? Because if it's a 2-bucket leak, you might be able to wait a little bit longer. So we're sort of in that mode, and the staffing is a challenge as well. It's been hard to recruit staff to work in a time of COVID for cleaning as well. That's been a real challenge. So we have our directors, Dave
Can I
Clapp.
break in again? I'm
Yep.
sorry, Ms. Weaver. Representative Earp had a question.
Thank you. So I'm guessing that a lot of this is related to COVID and therefore perhaps COVID funding. And I'm wondering, first of all, is that true? And second of all, do you have an idea of how much of it was you're able to use COVID funding to affect some of these changes, which sound like they may benefit us in the long haul as well?
You mean the challenges from COVID?
No, not specifically challenges from COVID. The changes you've made to your processes, your facilities, basically everything you've just been talking about. It sounds like many of those are COVID related changes, but at the same time, they were efficiency changes going forward. They could be efficiency changes going forward. And I'm just wondering how much COVID money that came to the state was used. Is there any way to know how much it was used in that way? Does that make sense or no?
I think I understand, but I'm not really, I don't want to answer in case I don't understand your question.
So let's take telemedicine. I mean, it's a bad example, but it's something I could sort of speak to. So there's an EO for telemedicine, which has obviously been a big benefit. And the legislature were looking at trying to turn that into a statute so that that benefit can continue going forward. That's not related to funding, I understand. But you've got, your department, I'm guessing, has gotten the lion's share of all the COVID funding that's come into the state. And it's not just from listening to you talk, it sounds like some of the things you've been doing to improve efficiencies and so forth have improved efficiencies, but they've also been specific to COVID because you've had to make these adjustments that are COVID related. I'm just wondering if you have a sense of how much of the COVID funding was applied in that manner to the benefit of the long term, if you will.
Yeah, and and it's hard to say how much of it was. I know it wasn't all of it. I mean, a lot of the COVID funding went to stand up these temporary sites, whether it be for testing or vaccination or cleaning. And then, yes, there were things that we had to procure, like the equipment to be able to do the telework, right? So, or the software that goes with that. So that went to it. And the idea would be to sustain that long term, right? That becomes a new business model for us to use. That's what you're talking about? Yes. Yeah. So I would say, maybe 50% or a little bit less than that for that. But a lot of the money did go out the door as well, the providers, to help us meet the need for the COVID. So there wasn't a whole lot in-house, but I think that said, there's a lot of what we're looking at now that we can be doing it differently and more efficiently. And we want to keep moving forward in that direction and not go back to the way that it was, right? So that is our main mission and vision moving forward.
Thank you.
All right, I'm keeping an eye on here for the time. So in terms of budget decreases and increases, a lot of the same things in terms of the work wouldn't get done or staffing would be impacted. And oftentimes when there's a decrease, people think, let's just close the district office. Well, it sounds like it might make sense, but obviously that's a complicated thing. But we are looking at trying to not necessarily, as I said, be in our brick and mortar, but we're still servicing throughout the state and not necessarily from one location. So when you think about all the eligibility that is, citizens say need help, right? They often would come into our brick and mortar. We found that they could actually be calling in and getting determined eligibility either through the system or through a phone call. So if we can keep doing that and we don't need to have the building, then that's what we're going to keep doing. So that speaks to what I was talking about before. Oh, we will always have somebody that needs to come into a building. Don't get me wrong. We will always have a need for some sense of brick and mortar, but not as big. So this is our current square footage. This is when you look at all of the properties that we have historically. I'm reminding you that some of these leases are 10-year leases. That's how we're able to get a decent rate of long-term lease. And then you can see the lease expirations. So as we move towards those leases coming up, we will look at, and Claremont is a really good example right now. State owns a Claremont building, but we're looking to downsize. We've found appropriate space because we know we're not going to be 100% in the building. Some will be telework, so we'll be able to, even though it's state owned, we pay DAS rent, we pay them rent. So we found property that would be equivalent or less to paying that. So that will be our goal as we move forward. And staffing, we have, I went through this before, about 25 staff for the maintenance and then 3.5, 4 for the district offices. And primarily general funds as well. Any questions on the facilities other than, I don't know what that slide is.
Not today. I might want to talk to you later about renting and buying and just more what you're thinking long-term, but not for this budget.
Okay, sounds good. So you're done with me now. I'm going to turn it over to Ann Landry, who is our Associate Commissioner, and she's going to talk about the Office of Health Equity, which is the last component to this presentation right here. Thank you.
Thanks, Lori. Good afternoon, everyone.
Thank you so much, Ms. Weaver. Really appreciate that. And so Ms. Landry, one of my first questions here as I'm looking at the term equity showing up in healthcare documents everywhere. Is this a statutory name, or is this like the old refugee office? What was this?
Yes, thank you, Representative Edwards. Before we start, would it be okay to bring in Barbara Sieber and Anela Krustica from the Office of Health Equity to join in part of this presentation? They're online.
Yes, ma'am. I was just so excited to get started.
No, thank you. My name is Ann Landry. I'm Associate Commissioner for Population Health, and I've been with the department for about 2 years and have about 20 years of experience in healthcare and nonprofits and education. So this is the former office. It's the name evolved over the last 2 years. It is the Office of Minority Health and Minority and Refugee Health that started in 1999. I believe about 4 years ago, the name, and Barbara can correct me if I'm wrong, the name changed to Office of Health Equity to be more all-encompassing, contemporary, and comprehensive of all the services that we
correct.
provide. Does that help answer your question?
You answered it perfectly. Yes, thank you.
Perfect. Thank you.
Sorry, I'm sorry to interrupt. Who were the two people I'm bringing in as a panelist?
I'm in.
Here and Anela Krustica.
Okay, here we go. Sorry.
And Barbara is our Director of our State Refugee Program, and Anela oversees our Communication Access Program. So I don't know, I don't think I have
control. Yep.
Okay, thank you. And I believe Beth Kelly, who's the Office of Health Equity Finance Director, is already in the room. Okay. So the Office of Health Equity assures equitable access to effective quality DHHS programs and services across all populations with a specialized focus on racial, ethnic, language, gender, and sexual minorities and individuals with disabilities. And I promise I won't read the slides. I just really wanted to read this particular sentence since it captures so much of what we do. Through the Office of Health Equity, we facilitate communication access across all of DHH's programs and services for all of the individuals needing interpretation, translation, both the clients we serve and our staff. We do a lot of education around communication access and the use of hearing assisted technology, vision and speech aids. We monitor contract compliance with all of our vendors to ensure that they are following the federal civil rights law requirements, including the training that's necessary. When we assist refugees in achieving the self-sufficiency at the earliest date possible after their arrival to the United States. On the next slide, the next two slides really capture these.
So I'm going to probably wave my hand a couple of times if.
Sure, of course.
We could go back, or this slide is okay. So it seems to me like you have an interesting combination of services that you provide here. It seems like you have a lot of direct population touching of actual people. And then you have this legal compliance function also. And I'm just, so my thought is, are those really compatible within one department to have a contractual civil rights compliance function with population services function?
Well, and I will let Barbara jump in as well, given her time here in this office, and perhaps Lori Weaver might have additional information, but I do think it's appropriate in this sense because the federal civil rights law piece of it is really to ensure that any contract that we have across the department is adhering to the ability to provide access for their clients they serve. So as we know, we have some direct service programs, but we contract out a lot as well. And we need to make sure that everyone across the state has equitable access to the programs as far as translation, interpretation, et cetera. And then we also have within our office, we do serve, you're right, internal and external. So we ensure that our staff are trained, our staff are educated. We are creating equitable opportunities across the board within our department, but then also to those that we directly serve as well. And I'll ask Barbara, do you have anything to add? Or Anela as well?
I think you made the point that it's compatible in that we're serving primarily the same group of clients or portions of the same groups of clients.
Well, so I don't want to throw you off because the whole budget is built around this notion, but maybe Ms. Weaver, someday we could have a conversation about whether the federal civil rights law compliance function, since it monitors contractor compliance, whether that should go over with the procurement and contracts group, if that would be a more logical subject matter alignment. But that's not for today because we're definitely into the budget and everything is where it's at now. But I just would be curious long term if that's really the right spot for it.
I will add Representative Edwards. I appreciate that question because it is very much in partnership with the contracts unit. So I think, there's two pieces of it, right? There's the day-to-day contract, the programmatic aspects of it, as well as the responsibilities that lie in the contract office. So it's very much in partnership with the contracts unit, if that's helpful.
And if I can add, Representative Edwards, Anela Krušica again, it really is referring to the Title VI, the Federal Civil Rights Law, ADA of 1990 and Rehab Act of 1973. All those have to be implemented in our communication access plan and in our trainings, and our staff needs to know the civil rights in order to equitably serve population of New Hampshire, residents of New Hampshire.
Thank you.
Okay, so that's a good clarification because I was focusing on the first many words of that description where it says monitors contract compliance with federal civil rights law requirements, and you're emphasizing appropriately the training and self-attestation checklist. All right, well, so I have much to learn. Thank you.
Thank you, Anela. So the next two slides summarize our program. So we have the Communication Access Program, which, as you can see, it serves the limited English proficient, deaf, hard of hearing, blind, visually impaired, and speech impaired. They have direct responsibility for the DHS policy and systems in hearing and oversight of the contracted vendors, which Anela just mentioned. And then, of course, that really is connected to the federal civil rights law compliance. We also are part of the statewide communication rapid response team, which serves all New Hampshire residents. There's other agencies involved in that, but Germano Martino, who is our communication relations officer, serves on that, and we liaison to all the communities and service providers and provide response coordination, due to layoffs or closing of a business. So very actively involved in that work. As we move to the next, we have the Minority Health Program, which is a little bit of a legacy name because it encompasses much more than just minority health. There's a lot of training and technical assistance to both staff and contractors and community stakeholders on culturally effective organizations and the education around enhanced national class standards. We serve the racial, ethnic, language, and gender and sexual minorities and individuals with disabilities through program planning and partnership. And we improve our own internal capacity at DHHS to ensure equitable access to quality services to all individuals. there's a small piece of our program that our office that does repatriation. And that's it. It's not a ton of work in our office, but if there is someone who needs to come back to the US into New Hampshire, Germano works there. And then of course we have the state refugee program, which serves all the refugees within their first 5 years to the US in New Hampshire. That's a federal program. Each state has a state refugee program. It's very, very specific to the federal regulations. Barbara has been the director of that program for quite a while. So I'm going to give her the opportunity to highlight any pieces you want to of that program, Barbara.
Okay. Well, we work primarily to help refugees achieve self-sufficiency at the earliest date possible after their arrival to the United States. So there are several mandatory components of the program, including comprehensive health screening, which also occurs overseas. Currently, people are quarantined 14 days for COVID, but the bulk of our work occurs in the first 12 months of arrival, and we contract out to agencies who help refugees seek employment. We develop employment opportunities for them. We provide English as a second language and case management to help them integrate into their communities within the first year of arrival.
Thanks, Barbara. So this slide looks familiar to you now. As Lori Weaver just highlighted with our district offices, this is really our delivery system as well for our communication access encounters. So you can see the volume throughout the state, not surprisingly concentrated more in the urban areas of where we've served the communication access needs of our of our residents and staff. And this includes in-person, over the phone, video, as well as captioning of real-time translation for those of hard of hearing. And then the map, of course, is our district offices that you just saw. This is a snapshot of the summary of individuals served since 2015 with our two main programs, which are the State Refugee Program and the Communication Access Program. So you'll see that there's about 1,000 residents each year for the State Refugee Program, and then you'll see the total number of encounters. Part of the reduction in the State Refugee Program of those served has to do with the federal administrations, the changes over the last years, and there was a reduction in the number of refugees allowed to enter the US. Representative Edwards.
So each of these are annual numbers, and because we help them for 5 years, there's a cumulative also. So between 2015 and 2019, it's really more like say 10,500 total in the population served. Am I reading your graph right?
I'm going to allow Barbara to, I'm going to ask Barbara to.
Yeah, this doesn't represent the arrivals through the program. This represents service to clients who are already in the United States. So we're allowed to serve people within our federal regulations for up to 5 years. Yeah. So this represents that. Last year, we only resettled 48 individuals in New Hampshire.
Oh, okay. So I didn't know how to interpret the number, whether it was the total population or just an annual population. So thank you.
You're welcome.
Thank you, Barbara, for clarifying. Okay. These are some of our key accomplishments over the past couple of years in the Office of Health Equity. I don't want to read each bullet, but you really can see the success rate and what our state refugee program is doing in the first few, as far as the number of unduplicated refugees receiving services, the percentage that 89% of employable refugees enter employment with an average hourly wage of $12.93. 100% are completing orientation, completing comprehensive health screening, are graduating from high school and moving on to higher education in a lot of cases. Then you can see that we've educated 387 community partners in the last year on hearing assistive technology and communication access apps. So clearly a need across our state, even more so during this time of COVID with remote, everything being remote. We've also provided 73 trainings on equity and cultural standards. And we've also partnered with public health on a COVID-19 equity task force that's comprised of about 50 community stakeholders, as well as developing an equity review tool to be used in-house. Some of our key challenges remain the same over the last few years. So data is nationally a challenge when it comes to collecting race and ethnicity data. Nationally, there's a lot of improvement, as well as here in New Hampshire. We put a lot of effort on that. Obviously, the pandemic has illuminated a lot of the disparities in health equity. And so even there, we were able to put more resources behind collecting this data and really helping our internal and external partners understand how to better collect race and ethnicity data so we can understand and analyze information better. There's also uncertainty regarding changes at the federal level with each different change in administration, how that impacts our target populations with the refugee program, as Barbara was mentioning. And we're also in a transition right now with our leadership. Our director of the last 10 years resigned late last year. And so, of course, there's always an opportunity and challenge with any new leadership change. But in the meantime, we are recruiting for a new director. So I know Lori touched on succession planning at a high level at the department, but just looking at our office specifically, we do have 4 vacant positions, including the director. So that is something that we will ask the new director to come in to really look at how to ensure that we have coverage across all of our areas and that we're growing our staff. The new leadership will present an opportunity to evolve the office's approach. I mean, a lot of what we do is really dependent on the funding that we receive. It's mostly federal funding, as you'll see. But of course, there's an opportunity to be more strategic in our work as well as tactical delivery. And so we'll be asking our new director to kind of look at what are other states doing in their Office of Health Equity. Yes.
So somebody's the interim director, though. Who is that?
So we don't have an interim director, so to speak. I'm really serving in that role. The Office of Health Equity falls under my portfolio anyway. And so I really have just stepped in and have been supporting the team through the absence of a director. So I guess it's essentially I am, but we didn't appoint someone necessarily.
Right, thank you. Thank you for stepping up.
And so that's a little bit about where we are. We're in the process recruiting right now, and confident we'll get someone in shortly. And just looking at, what are outcomes, how they would change with a 5% increase or decrease in funding. If we were to receive more money, we would definitely increase the number of internal and external equity trainings. It's clearly very important across our state. We would allow for more professional development opportunities and conferences and self-growth for our staff. And we would be able to expand translation services as well. Should we see a decrease, we would unfortunately decrease the number of clients served with translation services. We would have to reduce the number of trainings on equity and cultural linguistic standards. And we would potentially inhibit our ability to apply for and receive new grants, because of course we need resources to do. Yes, Representative.
So on translation services, are those, is the scope of that related strictly to obtaining health services, or are those translation services expanded so that they can go contract for an apartment, or they can interact properly at the town hall? What's the scope and the boundary of the scope for translation services?
Thank you for that question. I'm actually going to ask Anela if she's much better at giving a summary of our scope here. Anela, are you still on?
Yes, I am.
Thanks, Anela.
So the translation, we work off the federal HHS rule. And so we will translate all vital documents into languages that meet 5% or 1,000, whichever is lower. And so currently only Spanish language meets that threshold. and we will translate all vital documents across programs in the department. If the staff is receiving documents in another language, in order for them to process or do their job, they have to be able to access that document. We do translate those into English so that we can do our jobs. And then if the decision has to be sent in the language that family speaks, we will then translate our decisions into those languages. I hope that answered the question.
Very, very, very nearly. I'm just curious about the definition of a vital document. Is it vital strictly in the healthcare sense or vital to being able to be an independent adult?
For different programs, it will be whatever that program identifies as a vital. Usually those are the consent. Anything that person has to sign, they have to be able to understand what they're signing. Application for assistance, but it excludes things like flyers and brochures unless it's, so rights and responsibilities will be a vital document, but here's helpful things to know is not a vital document.
Thank you. Again, just a breakdown of our recommended positions across our office. We have 8 in the Minority Health and Refugee Affairs piece, and then 3 in the Refugee Services unit. A breakdown of our funding. As you can see, we are primarily federal funded with a little bit of general funds. And here are the references to the budget book page numbers and the briefing book page numbers. And that is it. So I know I spoke really fast to get us in before your noon deadline. So there's a few minutes left if you have any other questions or for our office or for Karen or anyone else.
Very nice job. Are there questions from the committee?
Yes.
Representative Weiler?
I have scheduled a pre-fiscal at 3:30. Do you think we'll be wrapped up by then?
So I was just going to go into that. We're going to shift things around a little bit. We're going to take a break for about 15, 20 minutes since most people are at home to just get their lunch and get ready to start again. We'll start back up by 12:20, and then we'll hit legal. And we'll hit legal top to bottom from the overview to the budget numbers, because Ms. St. Sierra has to be gone at 2 o'clock, I think. And then of the briefings we've heard so far, the high level, will go into the detail. We're going to defer IS until Monday. And what else are we deferring? Are we deferring anything else, Kevin?
Yes, it would be DPQI, which is Meredith Toulouse.
Right. So we're shifting around, and I think we're going to hit your 3:30 timeline. Is it? You said 3:30, Representative
Yes,
Weiler?
thank you.
Yes, sir.
Okay.
So I'm sorry, just to clarify, Chair, you're suggesting that we'll go back to the accounting units from this morning's presentation as well this afternoon? Or would those
That's my plan. I'd like to let legal go through everything from top to bottom, and then so she can be excused, and then we'll start going through the accounting detail of just the departments we've already heard the high level on today.
That's something you can make a sandwich on. You give me 20 minutes.
Okay, great. If I could just say, Dave Clapp and Paula, please make sure that you come back. I would say around 2 o'clock, 1:30, when we'll be covering your accounting units. And the same thing with Anne and your team as well.
So I just have to say, this is the first time I've been in a real finance meeting and the first time I've chaired a real committee. So I appreciate everyone's flexibility and willingness to work with me. I'm trying to get my sea legs a little bit. So so thank you. And with that, if there are no questions, am I supposed to take a motion to recess till 12:20, or do we just do it?
You don't need one.
All right. So it's now 11:58. I'll see you in 22 minutes.
So let us start the slideshow, which I don't remember. There we go. So are we ready to begin? Is everyone on or?
We cannot see your slide presentation though.
You
We just see
can't. You can just see what?
your desktop.
That's strange.
Nice looking desktop though, nice and clean.
I'm an attorney. I have to keep things organized. Let me try that one more time.
Thinking you're going to say you killed everything due to your data retention policy.
Can you see it now or?
Yep.
Okay, great. How about now?
Yeah, it's weird though.
Yeah, it's weird on my screen as well. That's very strange.
It works though.
Okay, great. So thank you everyone. For the record, my name is Melissa St. Cyr. I'm the Chief Legal Officer for the Department of Health and Human Services. I've been with the department for 4 years now, and I oversee the Office of Legal and Regulatory Services. So on the agenda today is just going over our legal and regulatory services, some of the key services, the caseloads, and then key challenges that we have in our office. So the purpose, the overview of legal and regulatory services is to ensure that we adhere to and fairly apply our laws and regulations in implementing legislative policy. The 5 areas in which the office oversees is the Bureau of Licensing and Certification, the Legal Bureau, our Administrative Appeals Unit, our 2 ombudsman's offices, and legislative services, which I'll get into a little bit more. So under our Bureau of Licensing and Certification, we have child care licensing, health facilities administration, community residences, and our life safety survey team. So I'll go through each of those. Our child care licensing team, they do on-site inspections at child care facilities. Those could be center-based, they could be family-based centers, and then they also could be residential care where children are placed from all residential for residential reasons, for residential purposes for all different reasons, including kids who are in the custody of DCYF. We also review and inspect licensed exempt providers, and those are providers that receive federal funds but are not subject to our state licensing regulations because they have 3 or less children in their care. So we review for ensuring, we ensure compliance with state law, also our administrative rules. We approve and issue licenses. We do disciplinary action and we also oversee summer and recreational camp licensing. That is a very new thing for us. We just took over this year. And it was a very strange year, as you can all imagine, when it came to camps and COVID. So, I've given you numbers later on, but they're a little squishy right now because it's unclear what a normal year would look like when it comes to camp licensing. Our Health Facilities Administration team oversees the basic standards for all health facilities that are that operate in the state. Those could be medical facilities, residential care facilities, and then non-residential healthcare providers, which I'll get into a little bit more. But that Health Facilities Administration has a licensing unit, the certification unit, and community residences. And I'll explain that on the next slide. So health facilities licensing is our state licensing rules and regulations. It's the licensing of all types of health facilities, hospitals, walk-in clinics, nursing homes, substance use disorder residential treatment centers, ambulatory surgical centers, assisted living facilities, and whatnot. So they obviously have statutes and rules that they have to comply to as well. We investigate complaints, we inspect them annually, and we license them accordingly and take disciplinary action or enforcement action when necessary. Our health facility certification team is certification for Medicare and Medicaid. So our nursing homes, our hospitals, all of those who receive funding from the federal government are required to be certified. And so our survey team here at the department, that's part of certification, oversees and regulates based off of CMS regulation, not based off of state law and rule. So their role is very specific, and it's federally funded. Our next group under the Bureau of Licensing is community residences. Those residences care for developmentally disabled, acquired brain disorder, and behavioral health diagnosis folks. Those community residences could have very small number of individuals in which they serve, 1 or 2, and then they have licensed homes, which are 4 or more. We don't have a large number of licensed homes. Most of our community residences are small, and there's approximately 1,200 of those in the state. And they need to be certified. They get certified for funding under our developmental disability program. So the certification process is inspecting and ensuring that it's complying with the rules and regulations around state law and rule. But it's not, it's less of it is a licensing function still, but it is a certification function as well when it comes to the funding to certify that the residence is in compliance so that it can receive funding for DD, acquired brain disorder, and behavioral health. Life safety in health facilities construction is ensuring that facilities are in compliance with our state fire code, as well as international building code. They review sprinkler systems, ingress and egress, building code issues, and ensure that the facility is built to the proper code of the healthcare, the proper building code, whether it's the healthcare chapter or residential care, ensuring that those sprinklers and whatever else is required is done accordingly. We work very closely with the fire marshal's office in this for this part of our bureau. So that is it for health facilities for the Bureau of Licensing and Certification. Our next bureau is legal services and our general counsel. There's a lot when it comes to our legal services, as you can imagine. With a department as big as ours is, we have an incredible amount of legal matters that we deal with on a day-to-day basis. And it talks about here defending administrative decisions, litigating New Hampshire hospital commitments, pursuing debt owed to the state, advising on internal and external audits, responding to lawsuits, providing legal advice and general counsel on matters within the department, such as developing, implementing policies, interpreting state laws and rules, investigating and advising on personnel concerns, right to know requests, contracts and procurement, HIPAA compliance, promulgating administrative rules, basically anything that our department does and needs general counsel for. Our DCYF folks are the DCYF counsel that represent the department to protect the safety and well-being of the children in DCYF's care. And so they do litigating abuse and neglect issues filed by the agency to protect children. The DCYF counsel is structured a little bit differently within the department. And they are a dotted line to me under the Office of Legal and Regulatory Services, but they really report it's for funding purposes and obviously relational purposes for our department, but they report directly to the Attorney General's office. They are overseen by their legal decisions and other things like that are overseen by the Office of the Attorney General. Our Child Support Council is another big area. We have about 26 attorneys and paralegals and other staff in our Child Support Council. They represent the Bureau in state courts for establishing paternity and also the establishment and enforcement of child support and medical support orders. So they do interstate establishments, they respond to lawsuits against the Bureau, they provide legal advice, and also general counsel for the child support unit. And our legislative services, I'm sure you all have worked with John Williams in the past. John is their Director of Legislative Services, and all legislative services are worked through the Office of Legal and Regulatory Services, and a lot of our attorneys are the legislative liaisons that you see come and testify, and so they serve as a resource, obviously, for the legislature in providing testimony information on important matters that are coming up in front of the legislature. Our Administrative Appeals Unit is next. We have a adjudicative process for fair hearing for a lot of applicants. They provide an objective impartial review. They get their power, their authority from the commissioner. Basically, any final decision that's made by the department can be appealed through the Administrative Appeals Unit. There are, dozens of different types of cases. I gave you a brief description of the most common types that the Administrative Appeals Unit hears: long-term care, child abuse and neglect, APTD, our aid to permanently totally disabled, our developmental disability eligibility, food stamps, just New Hampshire hospital cases, medical assistant cases, and prior authorization for durable medical equipment and prescriptions. So there's lots and lots of different cases that they hear, but those are their most prominent, I would say, the things that they see the most of. And the AAU is great because they're able to see if there are across the department, if we have, if we have incidents of repeated concerns or cases that come up, they can, help the department identify areas of improvement. Our ombudsman's offices, there's two of them. One of them is strictly for clients. It's to allow clients to contact and have anonymous, spot where they can call and speak to somebody in the department, and that ombudsman's office will help them resolve and investigate matters. And they'll track patterns of concerns and complaints. They'll analyze systems issues as well, but they serve as a mediation. They don't necessarily represent the department. They don't represent the client. They are really there to kind of be that neutral to see where the problem may lie and if there's any way to resolve it. That's different than the Office of Long-Term Care Ombudsman, where they investigate complaints regarding our nursing homes and assisted living facilities. That it could be quality of care, quality of life, violations of resident rights, and they are the advocates for the long-term care residents. Their role is to be an advocate and to help them through any kind of concerns or issues that they're having in those long-term care facilities. So they provide consultation and education. They certainly have been vital in our COVID response in assisting long-term care facilities through that process. And so there's only a handful of individuals who are in that office, but they're very important. So as for caseloads, I just gave you some numbers here, how many inspections we have done in each of our bureaus or each of our, I should say, the license from licensing's perspective. So childcare licensing, 801 licensed and 22 licensed exempt facilities. That's 46,000 childcare license slots that are available. They do about 240 complaints a year. Health facilities, they have inspection certification of 1,261 facilities. They do about 3,000 concerns or complaints a year. There's 1,268 certified residences, community residences, which we spoke of earlier, 62 day programs, and 2 adult family care homes. As for our legal bureau, right to know requests, we get 200 plus a year. Our estate recoveries unit takes about $6 million in for debt recovery for the department. We have a client legal services that's set out by statute that takes complaints regarding developmental disability, acquired brain disorder, and others. There's about 300 complaints there a year. Human resources, the complaints we get from human resources, our administrative appeals unit, that when they have to represent when our attorneys have to represent the department in an administrative appeal, we have about 150 of those. And then we have rules and our probate commitments and about 80 guardianships. As you see, DCYF, they have about 860.
Melissa?
Yes.
I think Representative Edwards has a question.
Yes, absolutely.
I just want to recognize Representative Urf, who has his hand up.
Thank you. Melissa, I'm just trying to map from your presentation under the key services, all these blue bars, to the spreadsheet under office, under legal and regulatory services activity. And under that heading, there's 7 things which match up with your blue bars. But there's a number of other blue bars, like for instance, Administrative Appeals Unit, Legislative Services, Child Support Council. Do those also map somewhere in the spreadsheet? Do you know what I'm asking?
No, I'm sorry, I don't.
Okay, so in the budget, there's OPS 952010, legal and regulatory services. And underneath that, there are subheadings, which you list actually further on in your slides, which I've already looked at. Down to that where you put which you ought to put at the beginning, at the end. But under your regulatory services, you list six accounting units. Then there's actually a 7th, which is your general counsel. But coming back to where you are to your bullets, that's only 7 of the 12 things you went through.
Most everything else is
Sorry,
within legal services and 5680. If there's not an accounting unit specific for it. So childcare licensing, health facilities are separate. Community residences is separate, Melissa. Operations support administration. I don't know exactly the split between what's in that and legal services. Beth Kelly may be able to answer that. And then of course, ombudsman and lawn care ombudsman are their own accounting units.
Representative Urf, the other thing is we're going to immediately go into those accounting details after the presentation of this overview. So okay. I have a question for you. Under these child care licensing, do you do this in a combination of scheduled and reactive, to where you have a regular plan to go out to look at them, plus you respond to complaints?
Yes, so we have their license is good for every 3 years. So they receive a renewal inspection once every 3 years. They receive an annual monitoring visit, and that is unannounced. It's something that we would go out and see how they're doing with compliance. And then we would also go out if we received a complaint.
And then as a former privacy officer, I have to tell you, HIPAA is with 2 A's, not 2 P's. It's just one of my pet peeves.
Absolutely. So going back to Legal Bureau, DCYF, currently 865 open child protection cases currently in the state. Child support, we have about 315 hearings a month, and HIPAA, which is spelled incorrectly, 66 incidents per year. That we have a HIPAA compliance officer that oversees our investigations around HIPAA. And then our administrative appeals unit, about 1,000 cases a year. Our ombudsman's office has about 1,274 cases a year. And then Office of Long-Term Care Ombudsman, 320 cases involving 531 different complaint codes. Those codes are identified by federal law. And then 669 facility and 1,302 individual consultations when somebody just calls to ask questions or talk about processes or whatnot. So our active litigation right now is, we have approximately 25 open active litigations that are of significance. We have one board of claims matter, one contract and economic tort matter. We have 7 employment related actions, some are that are pending with the Human Rights Commission. We have 9 personal injury actions, 8 with DCYF and 1 with YDC. And then we have 7 systems cases, which could lead to costly systems and program concerns and improvements or changes. So I've listed those here. The first one is regarding our developmental disability or case management services under 171A. The second, Azar versus Philbrook, is the work requirements through our Granted Advantage program that's pending with the U.S. Supreme Court right now. We have 2 actions under our IEAs, which is our involuntary emergency admissions through our state mental health system. One is in federal district court, and then the other is in New Hampshire Supreme Court. Both are related. We have one related to our state foster care system and other matters under DCYF. We have another one, Price v. Chivinet, which is for our CFI program. And then Kerrigan versus DHHS, which is a general DCYF matter. That's an appeal of a matter that the department has already won on a motion to dismiss, but they appealed. And then we have 2 settlements that I just gave you general broad. We have the amount that we had is $172,000 for employment settlements from 2019 to present, and then personal injury, $1,792,500, and those are generally our DCYF cases, but could be other matters as well. Yes, Representative.
So who does legal report up through on the way to the commissioner?
So the legal bureau is under my oversight, and then I report directly to the commissioner.
Okay, and then these 7 systems cases, as earlier today, Ms. Weaver was talking about transformation and visioning and stuff. Do you think that she looks at these systems cases to help inform what may need to be improved?
Absolutely. We've taken into account anytime that we get any litigation matter, we always review the matter, see if there is something that the department needs to, improve upon. If there's some reason why we think that they may have gone to litigation, and then we audit that, we analyze the problem, and we incorporate any kind of solutions into our plans going forward. Absolutely.
That's absolutely a great answer. Thank you.
So our major challenges, similar to everyone else, was obviously COVID, a large amount of staff turnover. We had a lot of individuals in both our legal bureau and our Bureau of Licensing and Certification who were close to retirement, and COVID. So COVID facilitated that retirement. So we ended up having more than expected. With the hiring freeze, it took a long time to get people onboarded. For our health facilities specifically, we had 7 individuals leave, and it takes about 6 to 9 months for our folks to become CMS trained in our certification team. And because of that, we still have a limited number of individuals who can conduct inspections because these other 7 individuals are still in training. So that has led to some significant stress on our current staff. Obviously that, and the fact that they're going out and inspecting facilities that they're required to go into COVID positive facilities every day. Obviously that's a stress. So COVID has certainly led to some additional stress that wasn't there previously. And then our legal bureau has been down as well. They were running for most of COVID around, general counsel was running about 50% capacity. So it was a difficult time, and there's a lot of work to be done. So I would say that that's one of the biggest stressors. The Administrative Appeals Unit, our biggest concern and challenge is equipment. With our appeals, a lot of times they were done in person at our main building in their office, but now that clients and everyone, you know, they certainly don't want to come face to face. We've had to change our systems and have a lot of things by doing video conferencing, a lot of changes to our system, and our equipment just isn't available. The equipment isn't up to par to be able to accomplish all of what needs to be accomplished with the Administrative Appeals Unit. And then legal, our biggest concern overall is litigation costs and personnel resources for discovery, and our litigation hold that creates a huge burden on the legal unit and the costs of the department for the considerable time and money that we have to spend on discovery and litigation holds for our
Just define
for
litigation
matters.
hold.
So when a matter is so one of the current DCUF matters, we receive notice that there's going to be a pending lawsuit. We're required to put all of our documents, emails, basically anything on hold, so nothing can be deleted. And it all goes into kind of like a cache, a bank, where it sits and just stays there to then be available for discovery for when the litigation moves forward, when the matter moves forward. And so that's a very costly thing because we need to obtain licenses to be able to get individuals on litigation hold so that their documents won't be destroyed during the pending matter until the suit is finalized. And so that's quite costly at this point. And we can certainly get you those numbers if you ever want to see them. This is just a percentage of our current staffing for legal and regulatory services. I know you've seen the slide in other places. And then the remaining are our pie charts, which Beth Kelly is the finance person, is on the line if you have any questions around these pie charts.
So you had over 150 people on the prior slide. I'm just curious, how many of those have to be attorneys, and do you need those who pass the bar? Must they pass the bar to work for the department?
So our Administrative Appeals Unit and our General Counsel and anyone who goes to court all have to be barred within the state of New Hampshire. So that's most of the individuals. There are some obviously in legal services that are paralegals that are, clerks and other types of positions within that help the units such as child support and DCYF. But I would say a majority of them need to be barred. And so these are all pie charts comparisons, and then these the overview of the pages and budget books. So other than that, that is the end of my presentation. If you have any other questions for me.
Does the committee have any questions? Anyone? So I think what we'd like to do next is to go ahead and all those accounts that you've got listed there, if we could start getting into the spreadsheet view of those, so we're going in a slightly different order. And I don't know if you need to remain for this, Ms. St. Cyr, or if Karen's going to do it, or okay.
No, she definitely gets to stay. I did bring up on the screen the chart that I did send over yesterday that has all the accounting units for OCOM. And I figured I'd just walk through quickly what the highlights are, and then we'll jump right into the legal accounting units, if that works for you, Chair.
It does. Thank you.
Great. So the ones that we're going to cover that are related to Melissa St. Cyr's area, the legal accounting units, start at accounting unit 5143. So the page you want to turn to in your budget book is 1170. And we will cover all of the ones highlighted in yellow right through to long-term care ombudsman. I'm going to jump over and I'll give everyone a second if that's okay, just to.
Yeah, do give us a second because I'm using the spreadsheet instead of the book. And I've not become facile at finding stuff yet. So
And-
5143 is called child care licensing, right?
Yes, sir.
All right.
Kevin, is Beth Kelly brought over?
I believe she is, but let me check. She is a panelist. She's currently muted.
Okay.
I'll ask her to unmute.
I'm sorry, Beth. Great, okay. So I'm gonna lead us, but quite frankly, Beth and Melissa probably are going to be the ones talking a lot more than I am, because Beth is the one that prepares these budgets and works with Melissa on them. So the first one is childcare licensing, which Melissa walked through what childcare licensing is. Just to set things up, of course, the expenditures are listed here through to a total. And then the amount of revenue is then listed down here, and the number of positions in this accounting unit is at the bottom there. We are fortunate in that this accounting unit is actually all on one page. In many cases, accounting units are split between pages in the budget book, but fortunately we started out with one that makes it nice and easy, all on one page. So Chair, I'm not sure how you want to go through this.
Is there any way you can enlarge that a little bit? My eyes are not quite good. That's wonderful. Thank you.
Okay, you're welcome. So Chair, I'm not sure how you want to proceed. If you want to give everyone a few minutes to look at it and then we'll take questions. What makes the most sense for you?
Well, okay, so the reason I use the Excel is because I just do a quick little formula to see how much accounts are going up. And I noticed in this one that the general fund is going up 51% or about $290,000.
Yes.
And I'm just looking for the short story of why.
Sure. So you're actually going to see this in a lot of the legal accounting units. One of the things that in changing how we budgeted, we realized that we have been under budgeting general funds in the legal area because of cost allocation. So fortunately from an accounting perspective, not from an operations perspective, because there have been vacancies, there hasn't been a shortfall of general funds in these accounting units, but we are now trying to budget them as they will be earned, which is a higher general fund percentage due to that cost allocation, which is the federally required system that I spoke about earlier.
I think you succeeded in confusing me. So Mr. Ripple, do you want to translate that? Since you know my limitations, what did we just say about why general funds are going up 51%? You're muted, sir.
I am muted. There we go. I'm not entirely sure how to rephrase. It sounds like I have the feeling I'm just going to be speaking like the same words Karen just said all over again, because I wasn't aware of this issue prior to now. Is there some feedback here? Is that on my end?
Beth, you probably have to mute. Her computer tends to give feedback.
Oh, all right. Okay. I just muted her there. So no, I wasn't aware of this issue prior to now, but it sounds like due to the way positions are funded, it's a cost allocation issue, Karen, mainly with positions. Am I understanding that correctly?
Yes, and it would relate to benefits and their training because the cost allocation would apply to all of their expenditures.
Okay. So in 2021 and earlier, this was not budgeted correctly in your view, and now it is budgeted correctly?
That's correct, yes.
So I don't know the details of that. I think it's something, if you want to look at this further, Representative, I'd have to get further information on it.
Okay, no, let me just ask a simple question then. If we're plussing up this account, is there an account somewhere else that we're decrementing so that on net it's the same? but it's going to facilitate cost allocation?
Not necessarily. Not necessarily.
So by that, you mean that there is no reduction somewhere else to offset this?
Well, our total budget is an increase over fiscal year 21. You know, whether this is part of that increase, I guess you could consider that, but there are certainly other areas of the budget that have decreases in general funds. But we don't look at it as like a one for one, like, you know, just because I increased it here, $200,000 doesn't mean I looked to another area and said, okay, now you need to decrease 200,000. We try to make sure that we budget correctly everywhere. And then if we need to make reductions, then we look at that globally.
And I also just want to point out quickly that we did also take on camp licensing, which was not in the budget previously for 19 and 20, or 21, 22, 2021, excuse me. So that is an additional expense that childcare licensing did not have prior to that they do now.
Representative Wallner, do you have your hand up?
Thank you. Yes, I do. Thank you. Karen, I wondered, what are the requirements around how much general funds do we need to match the federal? Is there a matching requirement or a maintenance of effort requirement on these lines?
There likely is. I could ask Beth to jump in, but yes, I think what you're referring to is part of how child care licensing is paid for is with federal child care development funds, CCDF funds. And so that is part of the federal funds that are in this accounting unit, and that does have a general fund matching requirement, or MOE. Beth, is there anything you want to add there? Beth, you're on mute. There you go.
Oh, I'm good with that, Karen, thanks.
So I would like to understand this deeper, but I don't want to take more hearing time right now. Just because of I think I understand that we've had to pay people previously, but we budgeted wrong, so it got fixed in a cost allocation effort to move money from where we had it to where we needed it. And now we're just trying to improve our budgeting. But it seems to me at the end of the day, we're still should be spending about the same amount of money, because in this example, there are 19 FTEs in the permanent classified throughout the period. So we're not actually increasing the actual cost from a personnel perspective to this department.
Correct. The total cost to this area is very similar. It only went up about $40,000, which if you look at the benefits line, that went up $70,000. So we did make other reductions so that the total budget was more in line with the previous year. But the fund mix, if you will, changed because of cost allocation changes.
So do you mean a different benefits line, or the one that's at 714,480 and the governor's recommended?
Yes.
Is that the benefit? Okay.
Yep, that's
'Cause I
for
didn't know
fiscal
if
year
there's like
23. Sorry, go ahead.
No, go ahead. I'm learning when you're talking, so you talk.
Okay. Yes, the benefits line for fiscal year 22 is 677,000, and for 23 is 714,000. Those numbers are set by just Department of Administrative Services. The same is true of class 10. I think the reason that you're seeing a reduction in class 10 from 994,000 to 987,000 and the same number of positions is what Melissa spoke to earlier, that we had some retirements in this area. So the people that retired probably were at the top of their pay scale. So they were budgeted in 20 and 21 at the top of the pay scale. When the position is vacant, it is then budgeted at the lowest level of the pay scale.
So just to be clear, I'm really concerned at the resourcing level, not the accounting level. And I think I just asked you a bunch of questions that drove you into accounting instead of resourcing.
Okay.
You know the distinction. I didn't really mean to do that.
Okay.
But so let's go on to the next department. Are there any questions on childcare licensing, 5143, before we go to the next section? All right. Which section do you want to talk about next?
So the next accounting unit would be 5146, which is Health Facilities Administration.
Oh, it's right there. Okay. All right, I'm ready to hear you.
Okay, I'm certainly open to any questions that you might have on this area. The general fund changes here are the same issue that we were just talking about.
Okay, in this case, general funds go up 73%.
Yes.
And like before, there's no change in FTEs.
Correct. And the overall budget actually went down in this area.
Because federal funds got backed out.
Correct.
So that's not good. What's going on with the federal funds? Why did they drop at 42%?
This is the same issue that we were just talking about. It's about the cost allocation. So the health facilities, Beth, are health facilities time trackers or are they something else?
Karen, we have a change request in for this accounting unit. It was keyed wrong downtown, so it's affecting the federal and other funds.
Okay.
Expect the federal funds to, after the change request is accepted or approved, we expect this to look more like 22. It was keyed wrong in 23.
Okay. I see that. It looks like it's missing $1 million.
Yeah, yeah. Yep. So.
Representative Wallner has a question. You're recognized.
Thank you. So, I mean, you just things come back, you know, when you say certain words. So I know that often in our budgets, we have had a lot of change requests. And I guess what I'm wondering, will we be getting a list of those sometime in the near future?
Yes, so typically what I do is I will put together in the House space, last time we had probably 20-ish. Does that sound right, Kevin? Of things that we needed to correct?
And I think at least, yeah, there were quite a few.
So I will put together a preliminary list probably mid next week that will probably only be 10 or 15. And then as we go through the session, I will probably have another group. Typically, Chair, just for your information, what we submit, they will have sort of two different tracks. There will be the ones that we net zero, so there's no impact to general funds. And then there may be some that we say, we made a budgeting mistake and there's an issue with general funds. As far as requests for additional services or different programs or anything like that, those would all happen during the budget presentations. So we only use change requests for budgeting mistakes. We don't use them to try to make requests for new funding.
Good to know. So it looks to me like the benefits and fringe benefits account for the substantial part of any changes to this budget.
Yes, and both of those are determined by the Department of Administrative Services. We don't have control over those amounts.
So are there any questions from the committee on Health Facilities Administration?
Mr.
It's
Chair,
34
I have one more question.
Oh,
It
please
isn't
ask.
just- Okay, it's more of a general question again. I guess since we are already starting through this, looking at the pages, one thing I would like to know from the department as we go through, is there anything, as we come to pages, is there anything in House Bill 2 that relates to any of these budget pages?
Okay.
Is there, we only have a draft of House Bill 2. We don't have the final document, but if there's something in House Bill 2 that is significant that we need to know that affects pages as we go through, we should, if you could bring that to our attention.
I will certainly do that. I do not have a copy of HB2, so as soon as I do have a copy, I will be able to do that. But to my knowledge, there's nothing that affects this area or
Okay.
That makes me curious about your process, Ms. Rounds. Are you made aware of what's going into HB2 as you're building the budget, or is it a surprise to you at the same time it is to us?
We make requests to what we need in House Bill 2, but ultimately that's the governor's, it's the governor's recommendation. So I would say that I probably know about everything in it, but I don't know for sure what's in it until I see the final published document.
Right, so you make a request and it's probably going to be fulfilled, but you don't know until you see it.
Correct, it's correct.
All right.
And
So-
I do have one more. I'm sorry.
Representative Wallner, please ask
Okay.
another.
Okay, I'm sorry. The other thing I'm wondering is as we go through these page by page, and since we've already started this process, can you also tell us of any items that you had in your budget request that were not accepted and not included?
Yes, I will do my best to make sure that that happens as well.
Okay,
Hard,
thank
though.
you.
That would be hard, right? Because you'd have to have a whole nother spreadsheet in your head.
Yeah, I probably have most of it in my head, to be honest.
Yeah.
God.
I'll forget a few things, but most of it is there.
And we also have those documents available to us. We have those documents. I would have to dig them out, but we do have
Not
them.
in my head, Representative Wallner, that's for sure.
No, not in my head either. I have to go
Yeah.
find them.
So, okay, so we're going to talk about general counsel next, 5680? Or what are you talking about next?
Yes, 5680, general counsel. And so to the earlier question, this is where most of everything that's not specified in another accounting unit, those are all pretty clearly labeled. What they are is here. So when Melissa spoke about John Williams is in this accounting unit here.
This is the one to cut then.
Melissa is also in this accounting unit. You're gonna make John cry. I hope he's not listening.
Ask a question.
Yes, Representative Earth.
So Karen, does that include all of those bulleted items that she had in that list of key points?
Yes, the appeals unit is a separate accounting unit that's labeled. I forget what that's labeled. We'll get to it in a minute. But everything else is here, yes.
Okay, thank you.
So I have a question that covers the previous area and this one. Just generally, this agency income line, how is this being used in health facilities and general counsel?
Beth, what is the agency income in these cases?
For 5680, the majority of it is the estate recovery fees and the county estate recovery fees. And then 5146 is the adult facilities licensing fees.
Are those, do they find their way into your budget because that's in a RSA somewhere? Or is that just obvious practice?
They would have to be in RSAs to be restricted revenues. Kevin, correct me if I'm wrong, but otherwise they would be general fund revenues.
That's true. If it's not in RSA as a dedicated revenue source, it automatically goes to the general fund. So there must be a law somewhere that directs these to the agency.
So every time, okay, got it. Every time I see an agency income, there's an RSA somewhere setting it up.
There should be an RSA or a chapter law, yes.
These are not the same thing as dedicated funds, or are they sometimes?
No. It's not the same as a dedicated fund that's a revolving account.
Well, I
That
see
is
a
what you see here is a revolving fund, that 003, that would be coming from a dedicated revolving fund, but agency income is restricted revenue.
Representative Nordgren, question?
Thank you, Representative Edwards. We talked earlier about the book that Health and Human Services will be giving us that may or may not give us some of this information. Karen, do you know when we'll receive that book?
You should have it tomorrow. Mary and I are just putting the finishing touches on it. Believe it or not, we're actually ahead of schedule. I looked to 2 years ago and we didn't provide it till almost the end of February. So hopefully you will have that in at least electronically tomorrow.
Okay, so mailing it to Hanover, which takes a long time, do we know?
I'm going to defer to Kevin.
Yeah, I'm going to have copies printed up and mailed out to you as soon as we have it. So if we have it by tomorrow morning, then if we have it by tomorrow, then probably by Monday, they'll go out in the mail.
Okay, thanks.
Are there any other questions on general counsel? It's going from 84 to 82 FTEs. Is that why? It's not a lot, but why?
They were likely transferred somewhere else, but I'll let Beth speak to that. And it'll always take Beth a minute to answer as she's pulling up information.
Plus that mute button can be hard to find.
Sorry about that. I actually am looking up information. Can I get back with you in a couple seconds?
Sure. It's not a material question. I'm just curious. I got curious. So what are we going to do next, Ms. Rounds? Which?
All right. The next one is community residences.
This is not a lot of money relative to other things, though, is it?
It is not. It is mostly just staff and support for the staff.
So are there any questions about community residences? All right, seeing none, I think we're ready to go to the next one.
All right, the next one starts at the bottom of this page. It's 5683, which is Operations Support Administration, which is the appeals unit. So this just has class 10 on this page. So I'm going to go ahead and go to the next page.
Okay, so this is going up 48%. And what's driving this? People, it's not the people number changing. Is this the same cost allocation explanation?
Yeah, the total budget is the benefits that's driving it up, and the general fund change is the cost allocation.
employee training goes up, but that's inconsequential. Okay. And then federal funds dropped 12%. That's also the cost allocation issue?
I'm sorry, I missed the beginning part of your,
I'm noticing that the federal funds dropped 12%.
yes, that's the change in the cost allocation.
And I keep asking that because if we've done something to where we're no longer eligible because of a decision we've made or a mistake we've made, I'd like to know about those. Those are probably pretty rare, I imagine.
We try to keep them pretty rare, yes. They do occasionally happen. You will hear when Meredith presents about audit findings, and occasionally we do have times where we are penalized for different issues with audits, but this is not one of those scenarios, thankfully.
Are there any questions from anyone on Operations Support Administration? I'm seeing none. Is Ombudsman next?
It is
Wow.
5696 on page.
I love it when a plan comes together.
Me too. On page 1175. And this represents what I was speaking about earlier about cost allocation and how sometimes it can be very low dollars. In this case, the cost allocation has $7 for this agency income. So those are the types of scenarios where occasionally there are very low numbers, but we're trying to cost allocate appropriately.
That's extremely precise.
You should see our cost allocation system. Kevin has seen it. It is quite complicated and very precise.
Okay, so this is not a lot of money. Is there anything else interesting going on in here? Like we've got some personal services going up. Are we converting a temporary to a permanent or something in here?
I don't think so, because the total number of positions didn't go up. Those numbers again are dictated to us by DAS, but I'm not sure if Beth might know why that one went up so much. Although it looks like the actuals in fiscal year 20 were actually higher than what we have budgeted in 21. So it could be that somebody was hired at a higher step. But Beth, do you know the exact reason?
That's okay. Are there any other questions from anyone on the Ombudsman? I don't want to hurry it, but we should keep moving if. All right, so long-term care Ombudsman next. This is really great. It's like somebody built the spreadsheet right. Okay. So we see a drop in the general fund of 7% here. It's not a huge amount of money, but is this one of the donors for the cost allocation maybe?
I guess you could look at it that way, but yes, this would be a change because of cost allocation. We also reduced the overall budget here, so that's part of it as well.
What allowed you to change the overall budget?
It looks like there was some money budgeted for contracts for program services that that's no longer being budgeted. It must no longer be needed. I don't know if, Melissa, you have any history on that.
No, I don't. I think that the travel reimbursement is also down. Our in-state travel reimbursement was at 38,000 in fiscal year 21. It's going down to 30.
Right, we also reduced the travel in-state and out-of-state travel. That was something that you'll see across the entire department as I asked that every area take a look at their current expenses and their in and out-of-state travel and their contracts and look for ways that they could reduce those.
Sure. I imagine you guys have some fairly tight administrative procedures to control out-of-state travel at this point.
The deputy well, first of all, out-of-state travel right now has to be approved by the governor. So we do very little out-of-state travel right now as a department, except for when required, when servicing clients. But even in non-times of out-of-state travel needing to be approved by the governor, all out-of-state travel is approved by the deputy commissioner.
So are there any other questions from anyone on the committee, long-term care ombudsman? So seeing none,
So if I remember correctly, then there's just the totals for legal and regulatory services. So that's the last accounting unit in Melissa's area.
okay, so this page would not be reflected in my spreadsheet that I'm looking at, right?
This last page that has all of the totals, I don't know. I don't know where the spreadsheet.
It wouldn't make sense for it to be in there. All right, well, so thank you. Are there any questions from anyone on the committee about anything we've just covered in the legal area? Because I think Ms. St. Cyr is getting ready to take off. She's got a 2 o'clock and you're going to get there early.
Yes, thank you. Thank you everyone for your time. Please reach out if you do need anything or anything comes up.
Yes, ma'am. Thank you.
Okay, so I wasn't sure, Chair, if you would like to now go back to the accounting units that Lori Weaver and I presented.
That'd be great. She's here too.
She is. She also does have to leave at 2 o'clock, but her staff will be able to stay on, so we will be able to answer any questions. So we're going to start.
I actually have to leave at 1:45 for the 2 o'clock, so.
Oh, sorry.
My staff were planning on being on at 2 based on before we broke what we said. Let me see if I can get them to come a little earlier.
Okay.
So which number are we going to look at with her? The 1159? Oh, no, the 5,000?
Yes, the accounting unit 5,000, 1159. And this is one of those accounting units that starts on one page and goes on to the next. So
Could I ask that you blow this up as you did the other ones?
Yep, sorry, I thought I left it zoomed in. There we go. Oops. So this accounting unit has the first 2 class lines here at the bottom of this page. So I'm going to go ahead and go to the next page where the majority of the accounting unit is. So this is the commissioner's office. This is where the commissioner and the deputy commissioner and the associate commissioner positions are. So most of these, as you can see, going back to that previous page, a lot of the salary and benefits are actually in an unclassified class line, not a classified class line. Also within this area would be our PIO office. So our communications office is within this accounting unit.
Sorry, Karen, I was going to jump in. But
thank you. I'm like, why can I not think of the word? Please go ahead.
Public Information Office, yes.
Thank you. I struggle with the acronyms too, Mr. Chair.
So Karen, does this also have HR and EAP and facilities in it, or just HR and EAP?
No, EAP and HR have their own accounting units.
So the only thing on the salaries is that it's not just the positions you mentioned. I think there's a bulk of the unclassified positions that are budgeted out of OCOM. Not solely, but there's a big chunk there. So when we look at that figure, it isn't 4 or 5 positions. We have about 88 unclassified positions, and most of them come out of OCOM.
Only 10 of them are in this accounting unit though.
Okay. I knew you'd know the exact number. What would you, would you like me to answer questions on this, Karen, or?
Yeah, I'm not sure if there are any questions.
Okay.
Well, okay, so if the committee has questions, we'll do that. But I'm still just trying to find it on my spreadsheet, and that's not your problem, that's mine.
Well, that's because
But-
there's probably a lot of 5,000s.
Well, there's a lot of 5,000s, and would you believe it? We have more than one commissioner.
How about that? Yeah, so we'll wait a minute, and I know that Deputy Commissioner Weaver is also working to get her.
They're on.
They're on now. Okay, great.
So we've got, I don't know if Kevin can bring them over, Paula Booth, Stacy Silva, and Dave Clapp.
What page number are you on, Karen, in your document?
We are on 1160. Beth, while the chair is looking for the accounting unit, did you find an answer to those two positions that moved out of legal?
I did. There were two positions that were originally budgeted in child support legal, but it was determined that they should be moved to child support program. So they were taken out of there and moved to 4270.
Great, thank you. I know Representative Urf was just waiting to hear that we moved positions. I know he was waiting for that answer. Sorry, that's going to be our running joke, sir.
All right, I found it.
Were you able to
Okay.
find it?
Yeah. Okay, so this is one where the general funds went up 45% by a little over 600,000 on average. And yeah, I wanted to ask about the indirect costs. What the indirect costs go up, I think 124%. And basically double, and the 390,000 growth, that's actually material. So what's going on with that?
Sure, that number I believe is also set by administrative services, but Beth, do you want to provide some background on that?
No, that's exactly right. DAS gives us a formula to use based on, is that the salaries? Or is that the one? They just give us a flat fee. They just give us a number that they're expecting to bill us over the next year, and that's what we budget.
Okay, so, but this more than doubled. So it makes me wonder, department-wide, what's going on with indirect costs, if it got smooth or if it just went up a lot.
I believe in the past, we may have spread the cost across more accounting units. I'd be happy to look into that. But it is a number that we're provided and we're required to budget.
Mr. Chairman,
Go ahead.
I remember something from the governor's budget briefing from Charlie Erlinghouse adding a new cost. I think it was either adding the cleaning cost to the rent or some cost he hadn't added to the rent before. So we may see that in every line from what I remember.
Yes, sir. I was just noting though that it was doubling from the previous year from 316 to 706 on average. So it's big. That's a lot of cleaning, but maybe under COVID, there's a lot of cleaning. I don't know.
Well,
And it does look like in fiscal 21 that it was under budgeted because our actuals in 20 were 500,000 and it's budgeted at 130 in 21.
I did take the average of those two for my simple little formula, but your
We'll have
point
to
is
look and
valid.
see if it's in every line or if it's just mainly in the commissioner's line. That went up that much in indirect.
All right, so you've got one more unclassified position. now remind me, unclassified means that they essentially have a negotiated salary, or what's the distinction between unclassified positions and permanent classified?
Lori Weaver, do you want to answer
All
that?
right, so our unclassified positions are unrepresented positions. So they're not part of the union, and they have a different salary schedule. So they're on a letter system, not a labor grade system that applies for all state agencies. And in that letter grade, I think it goes A through P, I think, and then there's 7 steps within each of those letter grades. So the salaries are supposed to start at 1, and if it's to start higher, you have to ask permission from DAS.
So who is being hired here? What job description? It's a new one, a new job description in the commissioner's office.
We didn't create a new position. It was moved from somewhere else. We cannot create unclassified positions. The legislature creates them. So we could let you know which position moved.
Well, if we're going to ask you so many questions. Don't chase that one down just because if it's not really an addition and it's just a move, it's less interesting.
Yeah, no, it's unlikely that we're going to see, well, we won't see any additions other than those conversions, which are mostly in New Hampshire Hospital. And those would all be classified positions.
So does anyone have any question about the office of the commissioner? Anyone from the committee?
As a result of the COVID-19 pandemic.
Okay, so I think we're ready to go to your next area.
Okay.
Executive order.
The next accounting unit is 5025, which is the Employee Assistance Program, or EAP for short.
$50.25. Okay, so I'm there. And this only goes up 3% overall.
Yes. And this is actually one of those areas that the general funds are down from fiscal year 21 from a cost allocation change.
So we got a little bit of a kicker from the federal funds. Is that an allocation issue, or did we get a new grant?
No, it's an allocation change.
Okay. I'm good here. Does anyone have any questions? Seeing none.
Okay, the next accounting unit is the one near and dear to my heart, which is 5676 Office of Business Operations. This is finance and procurement. A couple of things that I would just mention here. The telecommunications line, those are not just the phones for my staff. Those are the desk phones of the entire department. So when you see telecommunications and other budgets, it's for cell phones. This is just for the desk phones. We did that last biennium and it was very successful and worked a lot better. And because of that, we also did something similar in class line 22. You see that go from 3,000 up to 240,000. We are now going to pay for all of the copiers for the department out of our accounting unit. So they're not budgeted anywhere else. So there are just a few
You're
things.
not going to just create another cost allocation problem, are you?
It doesn't, because those would have been cost allocated likely across the department already. We were just making different areas pay for them, and it was creating more administrative work than needed to be. So we just put them all in one, all here under finance.
So then there's a very slight increase in personnel.
We did, the governor's, we requested in the agency phase, and the governor did approve funding some positions that have previously been unfunded, that were unfunded in 20 and 21. And he agreed to leave some of those funded in 22 and 23. We still do have many unfunded positions, but we have funded a couple more.
What are the couple? Do you know offhand?
I don't know them off the top of my head. I think at least one was a contracts position. I think one was a Medicaid position, Medicaid finance, a cost allocation finance position. I don't know the
You have
exact.
to cost allocate the cost allocation position?
We do. We do. Yes.
Are there any questions on business operations?
And I'm just going to go down to the second page just to mention that this is where you see that other funds that I mentioned in the presentation, that's 17 million. That's the costs associated with the Veterans Administration. I think it also is, and Beth, correct me if I'm wrong, but the face masks that are being sold at the liquor stores is also represented there as well, I think, which is the transfer.
That number on my spreadsheet. Do you know what line that might be?
Class line 103. So I'm not sure if your spreadsheet has budget or actuals.
Oh, I see it. I see 17 million in FY20.
Yes.
But I'm not seeing anything in the out years.
Nope, because, well, fiscal year 21 is just the adjusted authorized budget, which at that time we had not adjusted the budget yet for when this was loaded in August. We had not yet added the funds for the VA transactions that we've done this year in fiscal year 21. And I hope that by fiscal year 22, the VA will be able to procure their own PPE.
Okay.
That is my hope.
Well, good. The veterans, thank you for, and the governor for helping.
You're welcome.
Are there any questions for on Office of Business Operations? Okay.
The next
What's your
accounting
next
unit
one?
is 8137, which is workman's compensation. This is workman's comp across the department with the exception of the facilities. We did keep the facilities workman's comp within the facilities budget because of the unique nature of the workman's comp that generally happens in the facilities. We wanted to keep that with them, but the workman's comp for the rest of the department is here in 8137. And that's what the slight increase is. A couple of areas did budget their own workman's comp and we put it all into one accounting unit.
So is that why it goes up 41%? Because it's
Yeah.
just got more accounting units this time around?
Exactly. There was a couple of areas that would do like a $30,000 workman's comp budget, and we decided that that was more administrative work than was necessary.
Questions about workman's comp? All right, let's go.
And then 8584 is unemployment. That's pretty much level funded, level funded to the actuals in fiscal year 20. It is higher than what was budgeted in fiscal year 21.
Okay, so it's budgeted at the FY20 actual instead of the FY21 budget.
Correct.
All right. Okay.
The next one is 7208, which is Minority Health and Refugee Affairs, which you heard about this morning.
Say that number again.
7208.
7208.
Karen, I don't think we have Ann. I think she's still on the other side.
Oh, Kevin, can you bring Ann over?
Federal funds are dropping here, but we're expecting an increase in clients, are we not?
Beth, can you speak? I don't know that Beth can speak to the increase in clients, but Beth, can you speak to the general fund, federal fund split here?
I can because the language bank contract came into OHE from BFA. So on a whole, it used to be that health equity would have had a higher federal fund ratio, but due to the language bank having more general funds than federal funds, it's going to affect the overall total.
Okay, but overall, the department's getting the same amount of federal funds. It's just being put into different accounts. Is that right?
Yes,
Yes?
yes.
Okay,
Yes,
and then,
we draw every federal fund we can, I can assure you of that.
our general fund is going up 47% about.
I believe that's the language bank contract that Beth was just speaking to.
Now, did I hear right that the only language that we're really emphasizing is Spanish, though? I mean, or do we still need to do a lot of edge translations for vital documents?
Hi, this is Anne. Thank you for that question. I'm going to ask Anela to clarify again, just because she has all of the knowledge.
I just remember that most of it is Spanish, but it didn't sound like that was all of it, certainly.
So thank you, Representative Edwards. So for the vital documents, we mean applications to services. So those are mostly done in Spanish. However, we work closely with Office of Refugee Resettlement, and we look into the language needs in certain populations and district offices, and we try to have forms tailored into those languages that are actually being resettled in the areas. So in the past, when Vietnamese refugees were coming, we would get also Vietnamese language in addition to Spanish. Then we had Bosnians and Sudanese, so those will be the languages that we will translate. Currently, it's Swahili, Kinyarwanda, and Kirundi, because those are the groups that come from Democratic Republic of Congo. So we try to work with the department needs and make sure that the vital documents are available into those predominantly high utilization languages.
So thank you for all of that. Those are vital services. I'm glad you're working on it. I'm just doing some accounting here. There's a line called contracts for program services, which sounds like would be the language bank money, and it goes up about 97,000. But for the overall general funds, it's going up 304,000. So the language bank looks like it's accounting for about a third of the plus up in the general fund. And I'm just curious if I'm interpreting that right. And if I am, where's the other 2/3? What's going on? It's benefits maybe, and personal services. Okay, all right. So does that look right to you? I'm not going to do your name well, Ms. Crucia. Crucia.
Thank you. Yes, so the Office of Health Equity didn't have the communication access contract within our office. When that moved, our budget certainly looks different. I think this is the first time that the Finance Committee can see the difference when it moved from Bureau of Family Assistance. I do believe that's the only change. I don't think it's associated with translation per se.
Thank you for that. Are there any other questions about this line item? So just out of curiosity, folks at DHHS are referring to this as the Office of Equity. Is there a point where the name in the spreadsheet is going to change? And what's required to make that happen?
It's a good question. So we do have the ability to change the names of accounting units, but sometimes Department of Administrative Services decides that the change is such a different name that it requires putting it in an entirely different accounting unit, which then means that you start to lose the history of that accounting unit. So we're very careful about when we actually make those changes to make sure that they're permanent long-term changes, because otherwise we could go biennium to biennium, as those who have been on the committee a long time know, and end up moving things back and forth and creating more confusion. So we do regularly try to update those, but sometimes we leave them at the older names and just explain why it's an older name.
Okay, so I'm anti-chaos. I like that. I like having
Us
historical. Yeah. So, but I'm also conventional enough to want the names to match. If we're going to call ourselves one thing, it should be that way everywhere. But that's an operational problem.
I would, I can certainly chat with Kevin too. I don't know what the history has been as far as changing the names in the legislative process to know if that's a possibility. But I will have that conversation with him and with Administrative Services and see what that would look like.
Just so you know why, I mean, I'm trainable. Everyone on this call now understands exactly what you guys have done. But for public transparency into the budget, I just think we should have consistent naming so that the public knows what we're doing.
I understand and totally appreciate that.
All right, so is the next one refugee services? Is that the next one down?
Yes. Yes, it is. 72, I'm sorry, 7209. And
Can I
that
ask a
does,
quick question?
yes.
Yes, I'm sorry, I didn't see your hand. Go ahead, Representative.
That's okay. Karen, is it some way to determine the ordering of the spreadsheet relative to the ordering in the book you're looking at? Because they're not in the same order. Is there something that would help me map them, like alphabetization or something else?
I do not have an answer to why the order is the way it is.
Okay. So they're put out totally different ways, basically?
That would definitely be an Administrative Services question. I do not know.
Okay, thanks.
So this is 100% federal funded, is that right? This area refugee services?
It is, yes.
And are we calling this equity now too, or is this remaining refugee services?
This is part of the Office of Health Equity, yes.
Okay.
But this is
Once had a
specific
smart
to,
guy tell me, never change the name as long as they're funding it.
but yes, this is the Refugee Services Grant that is part of the Office of Health Equity.
The opposite was true, is if they stop funding it, you need to change the name.
I
Okay.
try not to use tricks like that, but I understand the sentiment.
All right, so
So then I
so
think,
since this is not our money, I don't know if we're asking a lot of questions on this section. I assume it's all well managed and no problems.
that is my understanding. I do
Yes.
not know of any issues in that area. So then I'm just pulling up back to the spreadsheet that shows all of the OCOM accounting units. So the other ones that we talked about tomorrow are here highlighted in green. So we're going to jump ahead to 5677, which is on page 1177.
Bureau of Human Affairs or Human Resources.
Yes, sir.
Okay, so the personnel are staying constant.
This is where, as Deputy Commissioner Weaver mentioned earlier, we do budget a lot of the training for the department, which is in line 66.
I don't have any questions here. Does anyone on the committee have questions for the Bureau of Human Resources? Seeing none. What's next?
The next one is 5685, which is management support. This is one of the facilities accounting units.
This one, the general fund's going up 29%, $3
I'm
million.
sorry, I didn't catch. Say that again, I'm sorry.
So I'm sorry, I probably had my hand over my mouth. This one is going up 29% or over $3 million on the general funds. So what's going on here? This is a pretty big jump, a material one.
So part of the increase is class line 28, which is transfer to general services. That is increasing $400,000. That is one of the larger increases. There's also class line 48, which did not have any cost in 20, that is going up. And so Dave and Beth, Dave Clapp, could you speak a little bit to the increases? And then Beth, maybe you can add a little bit about the general funds piece.
One of the increases was the transfer to DAS maintenance for future maintenance projects. That's based against their square footage cost, and I forget what the actual dollar value they use per square foot. Water and electricity, we're actually taking a drop from this fiscal year into the next fiscal year. We've done there's been a lot of energy improvements that we're going through to try to keep them operating as efficiently as possible. Telecommunications, that's some cell phones and so forth, because most of the phones have been transferred over to the other account that we spoke about earlier.
One that jumps out at me is the rents, leases other than state going up about 888,000 a year.
Yes, we've got 3 DOs that are in the process of being reprocured.
DO is district office.
Sorry.
Oh, okay. I was thinking delivery order, so thank you.
District office.
So
okay, so let me ask you a question related to what's going on in the corporate world. I hear corporations are trying to use the fact that they've downsized their people through telecommuting so much that they're aggressively renegotiating the amount of rental space they need. And so corporate America is cutting their rents now, I believe. And so ours are going up a lot. And I'm just curious if maybe there's an opportunity here for us to make some money and reduce our rents.
We always go up for RFP and we go for the best price that we can get for a rent figure. So we've always addressed that. The ones that we're having to address, the 3 district offices are older and the leases are at the end of their time. So they were a 10-year lease when we got them, and we're going to try to reduce the space as much as we can, but we're still working on what the numbers are that are coming back.
Representative Rogers has her hand up. You're recognized.
Yes, Karen, or I'm not sure if you answer this, and if this is the place, but I remember in the last budget, we had a whole rigmarole. We talked about, I think it was the Rochester office, and we went back and forth about space that we were getting from the city, and then we weren't getting it, then we were looking at new space, and I wondered, has that been resolved? Is that still one of the ones we're negotiating? Where does that stand, and what's going on with that rent or that lease?
That has not been resolved at this time.
So where do we
And-
stand? What's happening?
We're actually filing for a 2-year extension to allow us to reevaluate the office and any potential new locations that we can go to. The city was not happy in that the standard has changed for district offices considerably. So we've been there for almost 20 years, and it didn't have the safeguards put in place, and the meeting space for to meet with clients was below standard and doesn't meet ADA accessibility standards.
If I could follow up.
Please.
I think, would it be possible for you to maybe get to us a recap from, I think I have my paperwork somewhere, but it would be easier, Kevin, if maybe you could get to us the recap of where we stood 2 years ago with some of that material, and just bring us up to date with a brief memo of what's going on over there and where we stand would be helpful.
Yep, sure, I can do that.
Thank you very much.
So is that all your questions, Representative
Yes.
Rogers? I don't want to
Yes.
stop you.
Thank you very
All right.
much.
You're very welcome. So Mr. Clapp, I'm now looking at the transfers to general services. That's up about 885,000 on average, 15% increase.
Yes, that's dictated to us by DAS. They have a group, Bureau of Facilities and Assets Management, that's supposed to manage the properties on the SOPS campus off of Pleasant Street. And they dictate what the costs are that we're giving them.
So I'm just going to say it back to see if I heard you right. That this is essentially a contract that we're paying for so that they maintain our buildings on a campus.
Yes, it's similar to paying the rent. They basically take their expenses for the buildings and the whole campus and charge us for that.
Is this federal general services or is this a state general services?
This is the Department of Administrative Services, Bureau of Facilities and Assets Management. It's not general services.
Because it says transfers to general services. I was just wondering if that was a federal effort or if we have our own state level.
It's the state level.
And what would account for that? Just that they're charging us more or because they can or because the buildings are in disrepair and repair fits within this line?
The repairs are within that. Because of COVID, a lot of stuff was pushed off, and now they've got to catch up. The buildings are old. They do need maintenance that has to be addressed. So it's pretty much just to make sure that the buildings can be utilized.
Whose responsibility is it to take a look at our entire building inventory and decide what should just be torn down and built new? Who owns that plan?
That there was a master plan done by admin services, and there was some buildings have been slated to be torn down, which we're in the process of having the steam plant demolished. Some other buildings were earmarked to be demolished, but we're looking at trying to get them repurposed so that we can have office space that can be used properly.
So is that within DHHS or is that a state function?
That's
who does it?
That is DAS, Department of Administrative Services.
Kevin, which division is Department of Administrative Services part of?
I'm sorry, it's Division 1.
All right. Hey, thank you, Mr. Clapp. Do you have are you and Ms. Rounds going to do another department with us?
I
think
believe
there's
so.
one more, yes, the district offices.
5657, 5687.
87, I'm sorry, 5687. This is an area where we did leave the in-state travel reimbursement higher because these are people who are traveling to the district offices and helping service them. So that's unlikely to change even with less people in the office. As long as the office exists, people will have to go to them to maintain them.
Okay. Anyone have questions on this section? The DHH district office, just remind me, are these the 13 or so offices around the state, or is this one in Concord?
These are located throughout the state. There is one in Concord, but it is located throughout the state. There's Berlin, Littleton, Conway, Rochester, Seacoast, which is in Portsmouth, Southern, which is in Nashua, Manchester, Keene, and Claremont. I think I
That would
got
be the answer
oh,
to a
Laconia.
Division 3 trivia.
That houses all the divisions that provide services to clients.
Any questions from the committee on DHHS district office? All right. Well, thank you.
Thank you.
Okay. So that concludes all of the accounting units for the presentations that we went over this morning. It leaves 3 accounting units in Office of the Commissioner, 2 which are highlighted here in this blue color, which are Meredith Toulouse, and the one in purple, which is Bureau of Information Services. So I'm going to go ahead and stop sharing for now.
Let's talk about tomorrow a little bit.
Monday.
Yeah, that tomorrow, Monday. Let's do it like we did legal today, where we start at the overview and work our way just straight down all the way through the accounting lines. So that may shift IS back further, but it would release the quality people a little sooner also. So what do you think about that?
I think that works. So you're thinking that let's do quality and information services on Monday and wrap up for today?
Yes.
Okay.
I
think that will work fine.
So, because I know that Representative Weiler had a 3:30, so you're out way early.
Very good.
And I think that also makes a lot of sense because both of those presentations do deserve some time. They're both very weighty and have a lot of information, and I think it would be great to give them the time that they would really need to give you an understanding.
So you've seen our pace now. Do you think if starting at 9:30 on Monday that we'll be done by 3 or so, or what do you think?
Yes, absolutely. We might even get to take more than a 20-minute lunch and still be done by 3.
22 minutes.
Well,
Representative Weiler.
Don't we always have a Monday morning chair, vice chair meetings?
I think we may be in the calendar at this point, but you're right. But I think our kickoff is at 9:30 in the calendar.
It is, just so you know, Representative, if you did want to open that meeting at 9:30 and then recess until a later time, you could do that.
So I could defer our start till 10 without running into a calendaring problem?
If we were to open up at 9:30 and you were to come on and say you're recessing until 10, yes, absolutely.
I haven't attended one of those Monday morning meetings for a while, so it might be nice to know what's going on.
Yeah.
All right, so let's plan, is that okay with you, Ms. Rounds? You've got. your
That
whole
sounds
department.
great. Yeah, I think pace wise, we're doing fine. You had today and Monday slated for Office of the Commissioner. I will also let you know, I just had a moment to read through my emails, and Mary Calise in the background, as she often does, is working on putting together a list of all of the positions that moved throughout the department. So that will answer your questions for all those smaller moves that did happen. So we'll work on that and get that to you. I will work to get you the briefing book tomorrow, and then also the comparison, the 3,000 lines of information that I was talking about for 18, 19, and 20, and comparing to 22, 23 early next week.
Good. So you'll have something to do.
Always, always.
So, all right. Well, before we hang up, does anyone have anything for the good of the effort? Jonah, you've sat there quietly all day. You got to have something.
No, Representative. I've been writing down your requests, so I've been doing things. Don't worry.
Okay, I think Representative Erf has as well. So I don't know how you're going to coordinate, Representative Erf. Are you coordinating with Mr. Ripple or Mr. Feldstein?
We're coordinating with regard to.
Questions. You've been keeping track of questions too.
I was going to put them together for you and let you deal with them as you see fit. I can't hear you.
Copy Mr. Ripple and Mr. Feldstein, if you wouldn't mind.
Very well. Right there.
And Jonah, when you send those over, if you could send them to Mary Calise and I would be very appreciative.
I believe Kevin will probably be the one sending them over, right, Kevin?
Yeah, sure.
We'll figure that out.
One thing I did.
Representative Weiler, did you have more, sir?
One thing I did pick up in the governor's briefing, all these class 10 have gone up 10%, which I think is unreasonable. But part of it, and the thing they added to it, and we need to confirm this with this department as well, is they're going up roughly 2% everybody's wages, either step increases or contract. They're going up 5% over medical insurance, which we're self-insured. I don't understand how that's happened. We haven't gone up at all in county. And 3% because of the incompetence of the New Hampshire retirement system. We're not falling in line with our 30-year plan. And we're about 12, 13 years into it. And so the investments that they're putting things in are not getting a very good return, yet they're still assuming like 6.75, which means that they're getting further and further away from what they should be in the funding for that retirement system. So these are things that are endemic across the whole system that needs to be addressed at a higher level with the governor's budget guy. And I think they should be able to do something about that 5% increase in the health insurance, either reduce what they're delivering or go to a different coordinator. I think even though we're self-insured, I think they hire a third party to manage that. Obviously, there's not a very good job if it's gone up that much. So some things we got to deal with that are outside of the control of this division and this agency, if they're not going to control those things at the higher level. So unfortunately, we don't have that much. We don't have a 10% increase in revenue. So we're still stuck with searching for savings.
Do you have an update on when Ways and Means might send us their first guess?
Not till the 23rd is last I heard.
February 23rd or March 23rd? I'm sorry.
No, February 23rd.
Okay. All right. And then is it the practice of the Finance Committee to split that out to give the divisions targets?
Yes.
Okay. Very good.
We'll have to see how much we can come in, how close we can come, but you know, it's going to be tough. I've got a plan over in Division 2. You know, they're talking about a $50 million education trust fund surplus. We don't need to have a surplus in a fund that we need to use everywhere else. And since education trust fund comes out of the general fund sources, we need to change the percentages from the sources so that 50 million doesn't go to a surplus. We need to spend it in this budget. Thank you.
All right, anything else, sir? Representative Weiler, you got anything?
No, that's all I have. Thank you.
Okay. Representative Rogers, do you have anything for us? Representative Nordgren, thanks for sticking through the whole thing. Harry, you there, Representative Bean? Would you check out on us? All right, so with that, I'll go ahead, and I don't need a motion to reset or
No, not to adjourn. Thank you for giving me time to get ready for the fiscal.
all right. Well, thank you so much for your time today. Take care.
Goodbye.
Bye.